Yeah.
You don't have to wait for them all to sit down.
No. Okay, order. I ask the Minister to move any amendment you may have to present to the meeting.
Thank you very much, Sir Mark, and it's a pleasure to serve under your chairmanship. I beg to move that an amendment be made to the programme order agreed this morning in order to accommodate witness availability. The amendment would take Professor Linda Bold at 2:40 p.m. rather, and move the witness representing the Royal Colleges to start at 4:30. This will add on an extra 10 minutes to the last two panels, concluding oral evidence at 5:20 p.m.
Right, is that agreed, or are there any objections? Okay. No no's? Okay, the ayes have it. So the amendment is accepted. Okay, can I welcome the panel again, although I wasn't here for this morning's session. We will now resume hearing oral evidence from David Fothergill, Chairman of the LGA Community Wellbeing Board at the LGA, Professor Tracy Daskiewicz, Executive Director of Public Health and Strategic Partnerships and Vice President of the Faculty of Public Health at Honour and Bevan University Health Board, and Alison Challenger, Tobacco and Vapes Lead at the Association of Directors of Public Health. For this panel we have until 2:40. Right, the floor is open now to any members of the committee that wish to ask questions. We traditionally would ask the opposition spokesperson, first of all, to be given the question. So, Dr. Caroline Johnson, the floor is yours.
Thank you, Mr. Chair, and welcome to the witnesses. Thank you for coming today. My first question is, do the local authorities have the resources they need to enforce these regulations if brought in, and if they don't, what further resources do they need to have?
May, and first of all, thank you very much for the opportunity to come and speak to you. So from a local authority perspective, we welcome this legislation, and we welcome the fact that it's been cross-party legislation with the previous government and now with the current government. The legislation will only be as good as the enforcement. And I think that the question you ask is a really important question of have we got the resources to do it. And what we have to be sure of is that it's not a new burden on either local authorities or on retailers that we can't fund. So at the moment we would ask that we have time to implement. Time because we need to be able to consult with our retailers and with our public to make sure that we implement it in the right way. We would ask that it's viewed as a new burden so that we can have additional monies coming into the local authorities. And we would also ask that we set up an apprenticeship scheme for trading standards to ensure that we're bringing through new people into the trading standards and environmental health, of course, we have to mention them. But with time, focusing on those three areas, we will have the resources to make this successful.
That can mean lots of different things. Time could be weeks, months, years. What sort of time frame do you have in your mind?
I think the important thing is that we have the right consultation, that we have the right plan for bringing through new trading standards. I think we would be alarmed if you said you were going to introduce this on the 1st of January next year. But I think if you said that we'd got 2 years or slightly longer to implement it, then I think that we'd be much more comfortable with it.
Thank you, that's really helpful. What about the new licensing scheme that local government need to bring in? Do you feel that you've got the resources to do that? And will it give you the discretion that you think you need in terms of the location of such sites?
Again, I think this one's for me. So the licence, we argued at the last, I was here at the previous committee, under the last government to argue that we needed a licensing scheme. I think you may have sat on that committee.
Yes.
We needed a licensing scheme to make it effective. We still hold that view. We think that is right. What we shouldn't do, though, is to try to overcomplicate this. Because we already have licensing schemes. Many of you will have sat on licensing committees at local authorities. We have good local people that license alcohol outlets, that license taxis, that license gambling, gaming. So we believe that licensing is the right route to go. But whilst the legislation we think should be consistent, we do think that there needs to be local variations that we can look at, so that we can bring in what works for our communities, very much as we do with the alcohol schemes.
Thank you. Thank you, Chair.
Okay, I call Sadiq Al Hassan.
Thank you, Chair. Do you believe the measures in the bill to prevent vapes appealing to children are likely to work?
You can say a very short answer, but yes.
I think short answer yes. I think they do. I think the need to not have children exposed to marketing of vapes is a very important one. At the moment, we see that children are exposed to that marketing and are encouraged to get that access to vapes. So I think it is important that that is brought into the bill, and I think what is currently in the bill will help us to address that significantly.
I would concur completely. From a local authority point of view, we've argued long and hard about vapes, and we've spoken with your colleagues in DEFRA about the disposable vapes, which we've been very concerned about. So it's great to see this legislation moving forward. So absolutely yes.
Okay, I call Becky Cooper.
Thank you, Chair. And thank you for coming to give evidence this afternoon. As we've got two fellow public health colleagues giving evidence, could I ask you from the public health community what the general response has been about this bill, and if there are any significant suggestions from the public health community as to areas that we should consider further?
Thank you. Yes, absolutely. From public health community, I think it's widely accepted and supported. I think it gives us a great opportunity not only to increase the conversation but also to broaden the conversation. I think the key things is about how we embed the legislation into practice will be key, and make sure we're getting it to the point of delivery where we can affect change in terms of protecting our populations in the most effective way. So making sure we've got a focus on smoking cessation, making sure that we've got a consistent and unified approach, but also making sure that we have the agility and adaptability to different cohorts and different populations so that we can target effectively. But yeah, from a public health perspective, it's hugely supported.
Similarly, if I might add, from the Association of Directors of Public Health, it is very much welcomed that we've got this bill, and it will represent a sea change in terms of reducing harm caused by tobacco. It is still our biggest killer, and we still have significant numbers of people continuing to smoke and still addicted by smoking. So the product itself is not only extremely dangerous, it's also extremely addictive at the same time. So we welcome these measures to come in and address that.
Is your question on this issue, Mr. Gwynn?
Well, it's related to questions to the LGA, principally.
Yeah.
So, firstly, can I thank the LGA for the support and engagement that we've had in drawing up these measures. Can I ask you, do you think that the bill gives local authorities the right tools in relation to smoking and vaping, and how can we best work with colleagues in local government to get this right and workable on the ground?
I think the engagement has been really positive and constructive. We have faith within this bill that it is the right, it's got the right intention, that it's got the right measures and it's got the right provisions in it. Our concern is around about the funding and the timing and the pipeline of trading standards. But the key thing for us is that it's an empowering bill, so it empowers local authorities. I think if you try to legislate every single local authority to implement it in the same way, then we're going to run into some quite difficult conversations and difficult times, and it will make the enforcement more difficult. But by allowing local councils to do what's right for them, I think then that's the route to go. And people who sit on licensing committees have that local understanding. I'll give the example. Should we ban selling tobacco within 100 metres of a school? I think that would be quite easy to do in an urban area, but I look after villages. If you do that, they've lost their only shop. You know, people would not be able to go to that shop to buy legally. So I think you've got to have that local knowledge, and therefore it's the right bill, but we need to make sure it's an empowering bill for local authorities to implement it in their local communities.
And of course, local government has been at the forefront of enforcing existing tobacco measures. What lessons can we learn from the experience of local government in terms of enforcement to date?
So it is very much about having the feet on the ground. I mean, let's be honest, trading standards are under a lot of pressure. Trading standards have been cut over the last 10 years. Their trading standards look after over 300 pieces of legislation that they are responsible for enforcing. So there is a lot of pressure on trading standards. But I think that by working with retailers and building that relationship locally between trading standards and ensuring that we're using enforcement as the final tool, I think that actually we work very well in our local areas.
Thank you. And in respect of Professor Daskovitz, hope pronounced that right. We've heard earlier from the CMO of Wales and indeed from representatives of Ash Wales about the extension of outdoor smoking places in Wales. What can we learn from the experiences of Wales in extending to schools, hospitals and children's playgrounds?
Yeah, it's a really useful question. I think it's about looking at it through multiple lenses. So there is the enforcement element of it, but there's also the elements that go behind that. So if you take hospitals as an example in terms of having NHS smoke-free sites, enforcement is part of that, but it's also about having cessation services in place. So if you have people going in for elective surgery, for example, you've got a period of time where you can put in a smoking cessation intervention, so they're going to the hospital. It's a waiting well method, if you like, so that people are going into the surgery with the best possible outcomes and an opportunity to either get towards a quit or at least not going into smoking. And that enables patients then not to be going outside and using cigarettes and things like that, which enables that smoke-free site, but also creates better outcomes for our patients. So we do need to think about that. There's got to be a common sense approach. You know, there are areas where we do know that vaping is a tool towards quit smoking, so recognising that as part of that process. But where we can get people off tobacco smoking, that is crucial, particularly around health and well-being. So that outdoors, that open spaces element and the public spaces element is a part that we've really focused on in Wales. And the learning from that is still going on. You know, it's not the end of the road with that. We're learning all the time and adapting to new evidence and making the changes that we need to do to enforce that more consistently, but also in a fair way for our population.
And finally, Mark, obviously the measures in this bill include the introduction of a licensing scheme for England, for Wales and for Northern Ireland. Scotland already have their own arrangements that this bill will seek to extend. What would you like to see from a licensing scheme? Any one of you?
So I think that we'd like to see the licensing scheme very aligned to the alcohol licensing scheme. Clearly, it can't be a single scheme, but if I can just read for the moment, the four provisions within the alcohol licensing scheme brought in by the Licensing Act of 2003 was preventing crime and disorder, ensuring public safety, preventing public nuisance, protecting children from harm. If we can build those provisions into this legislation for the licensing of the sale of tobacco and vapes, I think that will give us enough to be able to work on. I would also say that the flexibility that we need at a local level still remains absolutely critical.
Okay, I call Tristan Osborne, followed by Ewan Steinbank.
Thank you very much, Mr. Chairman. So my first question is on the enforcement element. Some of the correspondence and feedback we've had is that the £200 level is too low. I was just wondering if councils or the LGA had a view on the appropriate level, and then conversely to that, if the level were too high, it would potentially damage high streets by loss of trade and shops closing because of a fear. Is there a worry in the local government community that we could see high street shops closing as a result of this? Again, that is some of the comments coming out of some of the correspondence we've received. So it's directly at yourself, sir.
So I'll take the fines first, and then if I may just talk about the cost of licensing as well, for those retailers as well. In terms of the fines, £200 is quite a low figure. I think it was £100 previously, so it has been increased. But £200, if you pay within 10 days, it's £100. If you sell 40 vapes in one day, you've paid your fine. So, you know, there will be some retailers, very few, because the vast majority are, you know, absolutely scrupulous, but some will take the view that they could sell more vapes to the underaged and people that they shouldn't be, and pay that £100 fine within 10 days. So yes, we do view it's too low. We would like to see a review brought in within a year of whether that should be increased, but it's a figure I think that people... In terms of the cost of fees for licensing, if we can align it with the alcohol licensing, I think that enables us to make sure that people who are selling alcohol, vast majority also selling tobacco, that can actually, we can find a way to reduce the burden, and we need to work with our businesses to reduce that cost of applying for those licences. And that's why we need this consultation period over the next few months before we bring in any legislation, to make sure we've worked with our retailers, worked with our public, worked with our communities to be able to deliver a scheme that actually works.
That banning smoking, the generational ban, might cause an increase in the use of other nicotine products such as vapes, smoke-free tobacco, or even illicit nicotine products?
Well, we're ultimately trying to reduce the harm caused by smoking. That is the big killer, and I think we really wouldn't want to lose sight of that. The bill also brings in elements around the smoke-free, the second-hand smoke agenda, and I think that's very important to recognise as well, that there are many vulnerable people that would potentially be harmed by breathing in second-hand smoke. So I think this bill is welcome. We welcome this bill to include that element of it. In terms of whether it increases vaping, it's really hard to know at the moment how that would work out. Potentially more people might switch to vaping, but I think ultimately this bill brings in a progressive approach to taking smoking tobacco out, and I think that is to be welcomed.
Okay.
You might not have the answer here, but do you have a rough estimate of what it costs the NHS financially to deal with passive smoking, second smoking every year?
I don't have the actual figure, but it is significant, and one of the early benefits from seeing this bill go through will be the impact on children in particular, particularly around asthma, because obviously second-hand smoke will be exacerbating some of those respiratory illnesses, and particularly with children. So there is a considerable burden on the NHS as a result of breathing in second-hand smoke. Also considering those that have cardiovascular disease, those that have existing respiratory illness. It's not always evident that somebody is vulnerable, so it's really important that the measures in this bill serve to protect those that are vulnerable from not inhaling second-hand smoke.
Yeah, go on.
And I'm assuming that from a public health point of view, looking at the epidemiology, there'll be certain communities and demographics that will be more greatly affected by this. Is that something that you're mindful of, and how do you see this sort of changing sort of health inequalities?
We're very very mindful of that, and I think some of the statistics that we give around smoking prevalence are an average smoking prevalence for often quite large geographical areas. So for my own area in West Sussex, I know that our local survey suggests there's a variance of 4.3% in our most affluent area, compared with, I think it's 16% in our least affluent area.
Yeah.
And they are still averages. We also know that in households, in our area, in households in the most deprived area, that 40% of children are exposed to cigarette smoking from a parent or carer. 40. Okay. Yes, that's through our own survey. I think the point I'm trying to make there is that there's a very different, very much a health gradient that we see through this, and those that are most disadvantaged, living in our most disadvantaged areas, are both, we see more high rates of smoking, and we see more children that are exposed to that smoking. And they themselves, of course, are more likely to take up smoking if they have been exposed to that.
Yeah, thank you. Thank you, Chair.
Thank you, Mr. Chairman. This is to Councillor Fothergill, if that's all right. Are there any circumstances you'd envisage where local enforcement wouldn't be enough and the Secretary of State would need to utilise their powers granted in the bill in Clause 130 and Clause 131 to intervene?
Thank you. So we've discussed this outside of the room, and I think the area that we'd be most concerned is online sales, illegal sales online, which our local teams just couldn't get into. And therefore we may need more national resources to be able to break into those, of how people are bringing illegal substances into the UK.
Mary Kelly-Foy.
I guess a question to all of you. We know that this bill will go a long way in terms of reducing health inequalities. In terms of the more deprived areas who do have the higher smoking prevalence, can you see that the bill will actually have an impact on the economics of the local communities, especially those in those deprived areas?
And this is exactly the focus, isn't it, in terms of this, in terms of reducing health inequalities, and also about ensuring we get good health equity across all of our populations. You know, when we look at preventable premature mortality, we know that smoking is a huge driver around that. So if we think about this across the life course, if we can stop secondhand smoking in terms of children and the harms that occurs, and then we think about deprivation across the life course and those people that are dying early from preventable harms, with smoking being one of the risk factors around that, if we can really focus on that and narrow those, because it's not just about life expectancy, it's about the number of years we live in good health. And we know from, you know, in my patch across Gwent in Wales, you know, there is a huge variance, up to 14 years difference in terms of healthy life years between the richest and the poorest parts of my population. And it's not only about the health outcomes around that, this is about the economic part of it in terms of work productivity, work days lost. So when we think about the cost of the NHS, which is often a factor that we do, that is the cost of healthcare. But then when you look around that economic picture, when we look at employability, productivity and those kind of things, it increases that economic sum by tenfold. So we really need to think about this. So when we think about the inequalities associated with smoking, we're looking at it through a social, cultural, economic and environmental lens to make sure that we get that full cost impact. So I think it's something that we really need to be mindful of.
I just wonder if I might add to that in terms of household.
People speak a bit louder. Unfortunately, the volume is as high as it can go, and it's still a bit quiet down this end of the table. So can you raise it a little bit? Thanks.
Thank you. Can you hear me better now? Yes.
Yeah.
I just wanted to make the point about household income, and we know that cigarette smoking is incredibly expensive, and if one or both parents smoke in a household where there's low income, then that is going to have considerable impact on the spending capability for other things for that family. And it's not a matter of choice either. This is an addiction. Smoking is an addiction. And many smokers, 7 out of 10 smokers, really want to not be smoking, but it's incredibly difficult because of the level of addiction. So I think it has huge repercussions if you have one or both people smoking in a family household, in terms of what that means for funding for all of the other household commitments they have to do.
We touched on local variations. So how do you think local variations should take into account the kind of small variations in health inequalities that exist in areas? For instance, your example of, you know, say, the only shop in a village, but if that village was also an area of high deprivation, how should that affect the outcome?
So I think that's where the local knowledge comes in. So if I take that shop in that village, we wouldn't say that they shouldn't sell tobacco, but we would say that they shouldn't be selling tobacco during these periods, i.e. 8:30 to 9:30 in the morning or 3:30 to 4:30 in the afternoon. And I think that it's knowing the local communities and be able to put in those local restrictions would help us to really impact. Clearly in urban areas, then it'd be very different. I would also say, because I think I should have said this when the Minister asked questions about England, Wales, Northern Ireland, the thing that we really, really would like to see coming in, which is in the Scottish legislation, is the verification that people are required to verify their age. The Challenge 25 seems to work really well with alcohol. We would like to see that brought in, and that is in the Scottish legislation, we understand, and we'd like to see it brought in England as well.
Any further questions? No. Well, if there are no further questions from members, could I thank the witnesses for their evidence today? And can we move, please, on to the next panel? Thank you. Hear oral evidence from Professor Linda Bold from the Bruce and John Usher Professor, who is a Bruce and John Usher Professor of Public Health and co-head of the Centre for Population Health Sciences at the University of Edinburgh. Can we thank you, Professor Bold, for being quite flexible and moving forward for today's session. And for this panel we have until 3:10. I think obviously Professor Bold's contributions and evidence later on in your packs. So if you want to refer to them, it is further on. So we'll take indications from 4 questions as well. Caroline Jackson, first of all, please.
Thank you, Chair. And thank you for coming today. A few questions, if I may. You've been monitoring and evaluating tobacco control policy for many years and stop smoking strategies. And earlier this year, you said you thought that a variety of things could go wrong with the implementation of the tobacco and vapes legislation. Now, we all want to see people's health improve, so we want the legislation to be successful in achieving that aim. So could you explain what you meant by that and where the areas are that you think could go wrong?
Thank you for the question. I think the first thing I would say is that I very much welcome this legislation. I also welcome the fact that introduced by the previous government and then brought back by the current government and the cross-party support that I've seen. And the academic community has really contributed a lot of evidence to inform this legislation. I think what I meant by those remarks was based on the previous bill, there were areas that could be strengthened. And of course, that's what we've seen in the current proposals, is new measures being introduced, many of which, of course, will need to be consulted on, and there's powers that can be acted on. But I think by those remarks, I was more meaning around the implementation of the legislation and the regulations that will be required. And as I say, a lot of that will need to be consulted on. But what we need to make sure there is that we strike the right balance between what I see as the 2 primary priorities in this legislation, which are to protect young people and prevent smoking uptake, also to prevent young people from the harms of vaping, and then also recognising the needs of the 6 million smokers we still have in the UK who we need to support to quit. So I think the proof is going to be in the pudding, and as all members know, there will be a lot of action that needs to be taken forward to make sure that we get it right at the regulation stage. And I would say that there are certain elements of those that need to progress at pace to make sure we seize the moment to get it right.
Thank you. Another question I had was about the research you've done into effects on pregnant women and children. We heard a little bit from the medical officers this morning, chief medical officers this morning on that. What effect does smoking and vaping have on the unborn baby and children?
Well, as you know yourself, it's one of the leading causes of premature morbidity and mortality for the mother if she continues to smoke during pregnancy and after the pregnancy. And we also know that it's a major cause of pregnancy complications and also for the baby in terms of low birth weight and even stillbirth and a variety of other complications. And as you know, the consequences of low birth weight are manifold in terms of what the health outcomes for the baby and the child. And then finally, as you've heard from other witnesses, if the mother continues to smoke, and often other members of the household are smoking, that child is exposed to secondhand smoke in the home and is also three times more likely to become a smoker themselves. So as we heard, I think, from the CMOs, or it could have been other witnesses, one of the great promise of this legislation is that prevention piece for young mums and partners, even preconception. So if we're preventing smoking uptake earlier, we know that the parents of the future are far likely to smoke, and the levels of smoking we have in pregnancy now are at around 9-10%. They've reduced a lot. We can drive them down even further. So I think it's important to make the connection between the smoke-free generation measures in this bill and also reducing smoking in pregnancy.
My final question is about exactly that, the verification measures, and the Challenge 25 we've heard about as being successful in ensuring that children under the age of 18 are not sold such products. But I had a look at the evidence that people are good at establishing how old somebody is. We're often told, don't try and guess someone's age, you can get yourself into a lot of hot water by doing that. And the research that I could find online showed that actually we're remarkably not very good at establishing how old somebody is. We're quite good at establishing someone of a similar age to ourselves. But beyond that, it's not that easy. What information do you have on the research in that field?
I'll speak just to the Scottish scheme in terms of Challenge 25. As we've heard from the previous witnesses, it is quite easy to implement, is widely used, and it is highly effective. So the benefit of the Challenge 25 is anybody who roughly looks around that age, so that you've got people there who are obviously a number of years older than the legal age of sale for the product they're buying, be it alcohol or another product. So asking to check age verification is actually a very effective way. So I would say in relation to the regulations as they're taken forward across the 4 nations for this bill, making sure that we have robust age verification as part of the scheme, I think could be effective.
Was when I was last asked for ID to buy a bottle of champagne and an orchid and a punnet of strawberries in a major supermarket was 38. And so we're not very good at working out how old people are, it would seem, or some people are not. We're going to not just ask people to decide if someone's younger than 25, but potentially ask them if they're younger than 45 or younger than 35. Is that going to be difficult for people to do?
So I think we also heard this from previous witnesses, as this legislation comes into place, so it's really not about 34-year-olds versus 35-year-olds, it's about stopping that or acting on the age of sale gradually so that we're denormalising tobacco use and we're stopping the start at an earlier stage. So I think by the time we get to the difference between the 34 and the 35-year-old, you will have far lower smoking rates than we do at the moment. If you look at the modelling that was carried out by the University of Sheffield for DHSC that is in the legislation, they suggest, as I think Hazel Cheeseman was saying earlier, that by 2040 we will have reduced smoking from age 14 to 30 to 0.4%, and by 2030 down to 6%. So I think you're going to see very low rates. But back to the Challenge 25, I think age verification is something that we can build in, and irrespective of how old you are, actually seeing that proof of age is something that I think will support this.
Okay, thank you.
I call the Minister Andrew Gwynn.
Thank you, Sir Mark, and welcome, Professor Bold. What impacts have tobacco control measures had on smoking rates over time? And what impact do you expect this bill to have?
Well, thank you, Minister, for that question. So I've been working in tobacco control for almost 30 years, and the impact that it's had, it has been phenomenal. So if you look back to the late 1940s, 1950s, we had 80% of men who smoked in the UK. We've driven that down gradually over the years. We started to measure it in about 1974. If you look at the levels of smoking that we have now, about 12-13% in the UK, second lowest in Europe. And the reason that we've achieved that actually is in line with what's being proposed in this legislation. It's using comprehensive measures and implementing them over the years to deregulate what I often call the 4 Ps: the product, the place, the price, and the promotion. You're taking action potentially on all of these, including the price with the levy that's coming in, or the tax on vapes. So we've made a lot of progress, but we're not there yet. And I think what you're going to hear from my clinical colleagues later is, in line with keeping that firm focus on prevention, which you're doing in this bill, we also need to keep that focus on cessation, and particularly marginalised group, deprivation, mental health, etc. So the key is comprehensive tobacco control. Keep doing it, and that is what this bill is adding to.
In an earlier answer that you gave to the Shadow Minister, you talked about the 2 priorities of preventing new smoking and tackling youth vaping, alongside supporting the 6 million to quit. This bill does seek to reduce youth vaping. How do you think that we best achieve that whilst not deterring adult smokers from quitting?
So in terms of not deterring adult smokers, if I start with the second part of your question, what we need to continue to do is make the products available for smoking cessation. So we're not banning vapes, as has happened, as the CMO for England was saying, in a number of other countries. But we're recognising that the things that make them appealing, attractive, and affordable to young people, we are taking action on. So I think it's fine for the adult smoker to not be able to see a wide array of advertised products on the shop front, on the billboard, at the point of sale, but to be able to know they're there and ask for them behind the counter. I also don't think the adult smoker who's trying to quit cares about gummy bears or Coca-Cola flavour. Maybe they want some flavours, but not all of them. So I think it is about striking that balance. And finally, and really importantly, although we're not here to talk about the funding of smoking cessation services today, and in England certainly you've made previous announcements about that, really important that in clinical settings and through stop smoking services, we can give good information about vaping and other cessation aids and support people to quit that way.
I call this Jarvis.
Do you think the bill goes far enough to protect children and young people from the harmful effects of tobacco and vaping?
I think it's very ambitious on tobacco. We will be, the first in the world, after unfortunate events in New Zealand, from my personal perspective, to introduce the smoke-free generation policy, and the world is looking at us. So I think that's good. I think in terms of the protecting people from vaping, what we have in the bill is a proportionate set of measures. But I do think, if I come back to the answer that I gave to the Shadow Minister, we really need to keep our eye on the regulations, and going back to the Minister's questions, make sure that we are, again, striking that balance. So I wouldn't be calling at the moment, given the evidence we have, for much stronger regulations on vaping. I think it strikes the right balance, but we just need to make sure that we do that in a proportionate way. And finally, back to the comments from the previous set of witnesses, also make sure that local areas have the flexibility around some of the measures to make sure that they're adapting it for their local circumstances.
Okay, call Dr. Zubair Ahmed.
Thank you, Professor Ball, for bringing your extensive expertise with us today. I wanted to just explore the intersection between poverty and health, and where you think this bill is going to impact. We know health outcomes are poorer. There are pockets of high deprivation in many areas of Scotland, including my own constituency of southwest Glasgow. And I'm just wondering what your thoughts are, both quantifiable and general, as to what the impact on those children and those particularly deprived communities of this legislation.
So, Dr. Ahmed, you know, as I think Sir Gregor Smith said earlier, that smoking rates in our most deprived communities in Scotland are about 26% compared to 6% in the least deprived, so very big, and we see that pattern across the UK. I think this bill will make a difference in several respects. The first thing is in preventing smoking uptake by gradually raising the age of sale. The evidence we have from studies that have been done by my colleagues at UCL and elsewhere is that previous rises in the age of sale haven't exacerbated inequalities but have had a benefit in terms of preventing uptake. So we know those measures from the evidence we have should be useful and helpful and not exacerbate that. The other thing is and back to the answer to the Shadow Minister earlier, by preventing smoking uptake in the groups that are likely to be future parents who are already likely to smoke, which is highly concentrated in our most deprived communities, we're going to have an impact there. So I think I don't see any signs in this bill when I look across the measures that we're going to be exacerbating inequalities with this, and I do think we probably will have the biggest impact in the areas where we have the most smokers, and those, unfortunately, are our most deprived communities.
Thank you. Danny Chambers.
Thank you, Chair. I asked almost word for word what I was going to ask, but from a population medicine point of view, do you have any sort of rough estimate on how much this is costing the NHS smoking, and if this is implemented properly, you know, how much would be saved?
So I haven't got in front of me the cost to the NHS, and other witnesses will probably have that at the tip of the tongue, but it is substantial. I mean, if you just look at the admissions to hospital we have at the moment in England, there's over 500,000 of those every year from smoking. We still have over 75,000 deaths. So I think by reducing smoking prevalence, you're going to see very significant impacts and cost savings. And the other thing we know from our own research is, and again, previous witnesses have said this, is the effect on productivity, on workplace absence. And in fact, as you all know in your constituencies, smoking is also driving some of the loss in people in the workforce that we've seen recently, for example, in their 50s, early 60s, and even younger than that. So I do think you're going to see cost savings, and you're also going to see an impact on productivity. The final thing I would say on that, despite not having the figures in front of me, is that this is an area that causes such a burden to the NHS. I think one of the things our CMOs didn't make clear earlier, although they said it indirectly, is if you look at non-communicable diseases in the UK, smoking is the only risk factor that's linked to all 4 of our NCDs. Respiratory conditions, cancer, diabetes, heart disease, the only one that is directly linked to all of those. So if you think about all of those diseases and the burden of disease that Sir Gregor mentioned of 21% increase by 2040 in Scotland, in my own nation, we are going to make an impact on that, and that will achieve cost savings for the NHS and importantly also for social care.
That's really well. Thank you.
Okay, I call Becky Cooper.
Thank you, Chair. And thank you for coming along this afternoon. You mentioned the New Zealand case, and I wonder if you could just talk about what happened briefly, if anybody doesn't know, about why the standards were dropped, and perhaps the learnings that we might take for our legislation moving forward.
So I think there are political aspects to that I won't comment on, but obviously the understanding was that it was a very comprehensive and ambitious set of measures that was introduced, not just, again, like this bill, not just the smoke-free generation, but other measures as well, including, interestingly, on the density of retail outlets, which maybe is for another day, one other potential future measure. So a new government came in and decided not to take it forward. But the learning, from my understanding, and speaking to colleagues there, that we need to take from that is going back to the CMO's evidence about the lobbying that's going to occur. You know, the tobacco industry and partners around the industry are very powerful. And so persuading colleagues that it's undermining choice, is going to have a burden in terms of regulation, cost to retailers, etc., those are arguments that were used in New Zealand. And I think we just need to keep a watchful eye as we think ahead to the regulations and the next steps for this legislation, that we don't open that door too widely and allow those arguments to become too powerful. Because as you heard earlier, that industry is continually looking for new recruits to replenish those it loses through morbidity and mortality, and that will happen in the UK as well unless we get this right.
John Whitby.
Yeah, just following on from the last 2 questions, actually. So, obviously, there's going to be health benefits in the future, there's going to be financial benefits in the future, but realistically, based on what happened in New Zealand, how quickly are we going to feel the benefits, public health wise and financially? You know, it's going to take years for us to realise the benefits of this bill.
So this is quite a comprehensive piece of legislation with lots of different pieces. If I just give you a couple of examples. So the areas we're looking at protecting more places from secondhand smoke. The health benefits of that to people who are vulnerable, people with asthma, respiratory conditions, cardiovascular disease, are very immediate. So I did a study when the smoking ban came in England in 2007, looking at admissions to hospital from MI, myocardial infarction, after the bill was introduced, and we saw in the first year substantial reductions in admissions to hospital for heart attacks. So I think some things will be quite quick. In terms of, again, the pregnancy question, if a woman is not smoking during pregnancy and some of the measures encourage that, then the health benefits to the mum and the baby are immediate and long-lasting. Some of the other things, I mentioned the modelling statistics on driving down prevalence. Obviously, that's going to take more time. And then the regulations you're putting in to protect young people from vaping. Some of those will have, I think, quite a big effect if you stop somebody from taking up vaping at all. And some of them will take a bit longer just in terms of driving down those rates. So I think it's a balance. The final thing I would say on that, and my opportunity, as you would expect, Chairman, for me to make this point, is please let's make sure that we do the research. And we support the academic community to do that research, to monitor how this bill is implemented, and so that we can evidence that what colleagues have put forward and decided to do actually makes a difference, so that other countries can look in that evidence and make up their own minds.
Osborne.
Thank you very much, Mr. Chairman. So I've read some of your research from Edinburgh indicating, and two questions from that. You said that in your research that you undertook 2 years ago, that 40% of smokers thought that vaping was more harmful than cigarettes. Can you just enunciate how the evidence base for that? Because that seems to be quite a high figure based on my understanding of the industry and from elsewhere. And then secondly, just linking to your economic argument you made earlier, you're right, deprivation is a key, there's more smoking in deprived communities. And I've asked this question to all the panels, is there a concern that because of the concurrency of people vaping and smoking, that people who are doing both will move to an economically cheaper option, so pick up smoking again because the vapes might become more expensive due to other measures that were introduced? Is that a concern in academia? Has that been raised as well?
So if we start with the first part of your question, so those data come from the ASH YouGov survey, so funded by Cancer Research UK, conducted by YouGov for ASH, and it covers Great Britain. So that's really concerning to me, those harm perceptions, because again, we don't want people who've never smoked or young people to be vaping, but actually, from the evidence I've seen, if more of those 6 million smokers could switch to vaping, we would see health benefits. So those misconceptions, I actually largely think they're driven by the media and some of the really harmful stories that get the front page. So we do need to deal with that and make sure that health professionals are empowered to give accurate advice and others about vaping. So we've got a distance to run on that, and anything that this bill can do to assist that would be welcome. On the people who are dual using, which is a significant proportion of smokers, are they more likely to switch to smoking if we're taking action on, for example, removing point-of-sale displays or other measures of vaping? I'm not sure about that, actually, because the key point is we need to continue to make smoking more expensive than vaping, and also make sure that we're addressing the availability of tobacco in our environment and in different settings. So if we can keep that balance to show that actually vaping is a good option for cessation, it's more affordable than cessation, while we keep doing the research on it, I think, I'd be optimistic that we're not going to see masses of smokers who are currently vaping to cut down just switch back to smoking in its entirety, hopefully.
Call Alex Barros-Curtis.
Thank you, Sir Mark, and thank you, first of all, for your evidence today. I just wanted to ask, reflecting on your wealth of experience in this area and your analysis of the bill and the comparisons to our international partners and counterparts, are there any aspects of the bill that you think could be further improved, noting obviously the difference between the previous government's version and this version. We heard one example from the previous panel talking about the fixed penalty notices, and for example, just as one example, £200, is that too low a number? So you may want to comment on that, but just generally on the wider parts of the bill, if there's anything else that you think could be improved upon in order to sort of deliver the public health and other benefits that we've espoused in this session today.
So, can I ask people to speak into the microphone if they can, because very often we're finding it difficult to pick up and the volume is on maximum as it is. Thanks.
Thanks.
So I think the legislation as currently put forward, is good. And I think there aren't areas where I would say the research community, in terms of the colleagues I work with, would suggest that the right measures haven't been put forward. I think they have been put forward. But I'll come back to the point I made at the beginning. I think it is about the implementation, so making sure that we get that right. And again, if I come back to the 4 Ps that I mentioned at the beginning, so just in thinking about implementing this, I think there are things that need to be considered in how we sequence things. So for example, in the last session, you heard from witnesses around the licensing scheme. So we already have a register in Scotland that works pretty well. We're going to move to a conditional register. I think as that's been consulted on those licensing elements, etc., let's at least get retailers in England and Wales on a register, so we know who's selling vapes and tobacco until we move to that next step. If you think about the promotion aspects of that, I think the in-store promotion in particular, so let me just give you one figure from a recent study conducted by my colleagues at the University of Stirling, the CRUK-funded VAPA study. When they asked young people where were they seeing the promotion of vaping products, it was on shop fronts and in a shop. So almost 2/3, that's the most common area where they see advertising promotion. Then posters and billboards, also concerns about social media, etc. So again, if you're thinking about what you might implement first, some of those promotions in store I think are important. And then on the product, removing those promotional characteristics from the packaging and labeling I think are particularly important. So those are the kinds of things I think need to be brought forward first, and think about really getting the regulation right. The only other thing I would say is in terms of the different products in this bill, and it is very flexible, let's not forget the categories that are maybe you haven't asked about yet. So I think one colleague mentioned shisha, but also smokeless tobacco products that are used in some of our communities in particular and often get through the loopholes. So I've done a number of studies on oral tobacco, which we know is very harmful, linked to mouth cancers and head and neck cancers. So let's make sure we just keep a focus on the range of tobacco products, even though the dominant product is used as a cigarette.
That's really helpful. Thank you. Thank you, Chair.
Sadiq Hassan.
Thank you, Chair. So we've spoke a little bit about kind of the gradual change and that preventing uptake, but how does the gradual change in the age of sale affect the impact on tobacco and vaping behaviour compared with increasing the age of sale in one go, based upon comments we've heard about this kind of difficulty in asking ages at 34, 35, although I think most people have no problem knowing I'm old enough for most things nowadays.
So I think that's an interesting question. So when my colleagues at UCL did the study that looked at what happened when they raised the age of sale from 16 to 18, I have to be honest with you, at the time, the tobacco control research community wouldn't have pointed to that as the most ambitious measure that you could do. And we didn't actually think changing the age by just 2 years would make an impact. But we actually, from the data, it created 1.3 million more people who couldn't be sold cigarettes. And we also know that the action on illicit tobacco, which is really important at the same time, the amount of illicit tobacco consumed fell by about 25%. So the two things in partnership, tackling illicit, which of course is really important, and changing the age of sale. But I think the promise of the smoke-free generation is actually much more ambitious. So rather than just raising it by a few years, you're gradually changing it over time. And I think that really does protect future generations. So you've not suddenly got this big jump to suddenly I'm eligible for, being sold cigarettes. So I think, again, if I go back to the evidence in the annex to the legislation, which shows you the modelling that's been done by my colleagues for DHSC, I think that looks pretty robust, and I think it will have a big impact over time. I hope that's helpful.
Okay. Any further questions? Tyrell Ottawini first.
You spoke about this, but are you concerned about the fact that introducing a generational ban of cigarette might cause other forms of tobacco use to increase amongst younger generation?
So it's really interesting. I think a similar question was asked a bit earlier. I don't think history actually bears this out. So there's often a concern that if you take action on one product, you then displace youth use to other products. What we've seen with the action that we've taken on smoking over the years is we haven't seen a dramatic increase, for example, in youth alcohol use and other legal products. Actually, the number of young people, there are still major issues with young people consuming alcohol, but actually the number of young people drinking at harmful levels has actually reduced in recent years at the same time as tobacco measures have been introduced over time. So I don't think you're going to see a big displacement by introducing this set of measures to other substances. But I think you do need to keep your eye on, as I say, getting that balance right. So we make sure that the other products that we're concerned about that young people might use, obviously drugs, illegal drugs, you've got legislation, separate legislation on that, keeping an eye on alcohol control for young people, all those things need to happen together. But I haven't seen any evidence that would suggest that taking this kind of action is going to cause some other public health issue that we need to be overly concerned about.
Okay. Jim Dixon. That's fine. Okay. Any further questions? No. Well, if there are no further questions, can I thank the witness, Professor Bold, for her contribution, and we'll move on to the next panel, which is the sixth panel of members, panel of witnesses. We will now hear oral evidence from Lord Michael Bichard, Chair of the National Trading Standards, and indeed Wendy Martin, Director of National Trading Standards. And for this panel we have until 3:30, as you can see, because both of the earlier panels finished earlier than expected. We have a fair bit of time extra for these two witnesses if they wish to use it, or if members wish to ask questions.
Thank you, Chair.
Yeah, could I call the shadow spokesperson, please, Dr. Caroline Johnson?
Thank you, Chair, and thank you for coming this afternoon to give evidence. Do you think the penalties that are proposed by this legislation are too high, too low? Are they sufficient to act as a deterrent? What's your thoughts on it?
Good afternoon. We'll try and be provocative so we can keep it going to help us through. It's as long as a piece of string in a way. I mean, if you compare it to some other penalties for other legislation, it's a bit low. On the other hand, trading standards can prosecute if we find, for example, that someone's repeat offender, then we could actually prosecute, and then I think the fines are up to £2,500. I think the only thing that we thought might be possible would be to have a higher level of fine for a second offence. I think the first offence is £90, fixed penalty. You could have a couple of hundred for a second offence, but we enforce, we don't fix the fines, we just do what you tell us. So it's not an unreasonable figure. It certainly could go up rather than down. You could have something for a second offence, and we could take action through prosecution for someone who was constantly offending. Sorry, I didn't hear that. The sound up here is not...
Sorry, I don't think the mics are working terribly well today. Wendy, do you have any thoughts on the size of the fines?
I mean, I think Lord Bishard has said that there are the varying level of fines that do exist. I think the other point that's worth making is the issuing of a fixed penalty notice isn't automatic anyway. A lot of this, especially around first offences, would be to try and support businesses with advice on how to comply with the law. So it's not a case of immediately you find something wrong, there's going to be a fixed penalty notice. There's a lot of drivers for compliance, and especially legitimate businesses that are going to want to comply with this. As we've said, prosecution is that option. You have got your £200 fixed penalty, but for those longer term or egregious offences, or definitely repeat offences, prosecution would likely to be an option through the Magistrates' Court anyway.
One of the problems with prosecution, of course, is it actually costs money too. And therefore, if you can train retailers then not to offend, that's a better outcome really than having to get a fixed penalty issued. And for local authorities, I think in particular, with the resource situation being what it is, the last thing you want is more bureaucracy around fixed penalties, prosecutions, all the rest.
So you welcome the concept of being able to say, this is the first offence, this is an educational opportunity rather than a penalty opportunity?
Do we welcome that? Yes,
yeah,
I do welcome
that.
That's I mean, I think it's our task to take a proportionate position. I mean, some people make mistakes.
Yes.
There is no point, and probably even a fixed penalty notice, if someone's just made a mistake. As Wendy has just said, training is probably a better option. But if someone is clearly determined to flout the law, then I think you need to increase the penalties.
Can I ask you about the training that's available to staff and shops that are being asked to comply with this? Because we've heard of Challenge 25, and people are asked, well, if you think someone's under 25, challenge them, because they might be under 18, just to be on the safe side. And I've been challenged myself right up to the age of 38 on such an issue. So if, in the event that someone makes that mistake, and you think they're reputable and genuine and it was just a mistake, and you want to provide them with training, is there training in how to recognise someone's age? Because we're not going to just ask does someone look young. We're going to be starting to ask to challenge people under 30 or under 35, and it can be more challenging to identify people in middle age and how old they are than younger. So is there actually any training available for people in the event they make mistakes?
Yeah, I mean, it's not complex legislation.
No.
One of the points I think we want to make on behalf of training standards is we're used to doing this sort of stuff. We're used to doing it for tobacco and illicit cigarettes. So it's not complicated. The main issue is, as you say, is age identification.
Yes.
And people are increasingly used to having to provide some identity, some proof of age for all sorts of things. So in terms of training retailers, that's about it. And if they've got any doubts, then they need to seek identity.
But if you're asking people to ask someone under 30, for example, for their ID, is there any training available to enable young or old shopkeepers to identify which people are likely to be under 30? Because we know that evidence suggests people are actually quite bad at doing that.
I mean, I think Sorry, you coming?
No, I was just going to say that, in terms of training provision, that training doesn't exist at the moment, clearly because the law's not in place yet. Yeah. But you're quite right, Challenge 25 is sort of the industry standard in terms of current age-restricted products, no matter what they are. There has been, I know certain industry organisations like the Association of Convenience Stores, BRC, others put a lot of training programmes on for members. I think there has been government-funded training in the past. The Chartered Trading Standards Institute hosts a site called the Business Companion, which has got very good, simple guidance and information that's specifically designed for small businesses, easy to read, easy to digest. So I think it's the change of mindset around needing to ask for date of birth rather than needing to ask, are you 18? Instead of, were you born, or when's your date of birth? So yes, there does need to be information out there, but I think as long as it's not complex. So it's a case of reinforcing that. But I think those routes do exist via those websites, via industry groups, and via pre-existing information that needs to be updated. And as much communications as possible to the public and to businesses as the bill goes through and gets a sense about what to expect and what's required.
And again, we'd want it to be proportionate because, small businesses can't afford to spend a huge amount of time in training rooms. And I don't think, personally, that this requires profound long-term training. It's pretty simple stuff. So a lot of it can be done informally.
Yeah. Okay, thank you. And Lord Richard, you talked at the beginning of your remarks about resources. Do you think trading standards have enough resources to implement these regulations and enforce them?
Well, I try and make it a principle of my life not to go around asking for more money from government or from the Treasury. So it's not my first kind of response. However, you've got to look at this in context. Training standards resources have been reduced by about 50% over the last decade, and the staffing in local authority training standards has gone down by about 30 to 50%. So we start from a very low base. The suggestion that's been made is that trading standards should get £10 million to implement this legislation, to enforce it, and that sounds a not unreasonable figure. But the way in which it's distributed is quite important. If it's going to be done on a one-year rolling basis, that makes it very difficult for local authorities to employ staff. You need some stability if you're going to employ staff. We think that if it's going to be £10 million, then it needs to be on a 4-year cycle, so that we know that for 4 years we've got that money and we can employ the staff. I think the other issue to be concerned about is that local authorities, I know, I'm a local authority man originally, have been under huge pressure. And there's always a temptation to take whatever money is there and use it on the highest priority. If this money is going to go to tobacco and vaping, I'm afraid it probably needs to be ring-fenced. I know there are some local authority former members here who won't agree with that. I don't normally agree with it. I think local authorities should have the space to make their own decisions. But I think if you want this money to go for tobacco and vaping, it's probably going to need to be ring-fenced. The final point I'd probably make, two final points. I know it sounds a detail. There's quite a lot of money has to go on storage and disposal. We think sort of 50p to £1 for every vape. So that's got to come out of the 10 million. And finally, and I think this is a really important point, some investment has got to be made at ports of entry. That's probably the most important intervention of all. And we depend on Border Force in particular to give us the intelligence to enable us to target our efforts, because we're already responsible for product safety at ports. So we rely upon Border Force. Border Force need to be properly resourced because they've got a lot of other, as you will appreciate, a lot of other important priorities. And if it's going to be effective at port level, then I think we feel that about 20% of whatever money we get needs to be spent there. I say this with some knowledge because I visited a couple of ports before Christmas just to see how the product safety stuff was dealt with. I was pretty shocked, actually. I went to Southampton and I went to Dover, and I have to say that on occasions I felt that whether or not we were successful was pretty random, because, as I say, we often were not getting the intelligence from Border Force, and I understand why, to enable us to target our resource, and we've only got a very small number of staff at these ports. So we shouldn't underestimate how important port entry is. Some money's got to go to that. So that's a long answer to your question. 10 million sounds a lot, but if you put storage, disposal, ports, that makes it look rather less generous, and it's got to be probably ring-fenced and on a 4-year basis if it's going to have an impact.
Thank you. That's a really helpful answer. We know that vapes are very difficult to dispose of, to recycle, don't we? So thank you. And thank you, Chair.
Okay, call the Minister Andrew Gwynn.
Thank you, Sir Mark. Very similar question to the one the Shadow Minister asked about whether you're confident that trading standards have the resources to enforce the measures in this bill. I want to ask whether you're confident that trading standards will have the right powers to enforce the measures in this bill.
I mean, I think we do feel we will have the right powers, based on the fact that we're already doing some of this quite successfully. I think we seized something like 2 million vapes last year. We carried out 400,000 test purchases, which is how we kind of check out whether or not the legislation is being enforced. And we seized 19 million, I think it was, illegal cigarettes. So this is not new stuff for us in a way. It's kind of bigger, but we have the powers, we use them, we think, quite effectively. We know that HMRC, in relation to tobacco, think we're pretty effective. We like to think we're a good delivery agency.
I think if I could add as well, there's been a lot of work in the development of the bill and the associated DEFRA legislation around the ban on single-use vaping products with officials, which has meant we have worked together with officials to try and get this in a good place in terms of enforcement powers.
Thank you. One of the issues that came up at second reading, it's come up in the previous iteration of this bill, is that some people do question whether moving to a smoke-free generation policy risks a growth in the black market and the illicit trade. Does that accord with your experience of the illicit tobacco market and previous tobacco control measures?
No, our experience of the illicit tobacco market is that it's reduced rather than increased, despite the additional regulation and the price rise and all the rest of it. It's actually reduced. So we don't think that this is a serious issue. We think that there are a number of myths around illicit tobacco and around illicit vapes which don't stand up to close scrutiny. So no, we don't think that's a serious problem.
And then finally from me, Chair, in the previous iteration of this bill, of course, the fixed penalty notices were to be set at £100. There was criticism and concern from representatives of trading standards who advocated for increasing the value of the fixed penalty notice, notwithstanding your answer to the Shadow Minister's question. Do you think that the doubling of the fixed penalty notice to £200 now strikes a better balance?
Yeah, I think we feel that, and as I say, you might also consider whether there's an increase for second offenders before you move to prosecution. I don't think anyone wants to move to prosecution because it's such a time-intensive process. But yeah, that would. I think the one thing we haven't talked about, I know we've got limited time. I'm talking a lot about retailers. We also ought to be concerned about the online market, or rather, you should be concerned about the online. So are we. And that's a difficulty for us and for local authorities, because I don't think any single local authority thinks it should be responsible for enforcing legislation in an online marketplace. Now, we have a solution to that, which is that we have a lead authority which we think could deal with this and avoid the problem with individual local authorities. But I think that's something which will become an increasingly important element of the vape marketplace.
Thank you.
Okay, I call Sarah Bull.
Just building on the point my honourable friend was just making a moment ago, is that the Scottish Grocers Federation has indicated in some of the information to us that in their latest crime report, the most prevalent causes of threatening behaviour in stores is the refusal of sale and asking for proof of age. And I guess what I'm concerned about is this rise in retail crime. I guess it's more like what more can be done. I know there's the education piece that is needed, but is there thought being given as to further how we can prevent this, these problems?
I don't know whether you want to come in on this. I mean, it does seem to me that it is now such a part of life that I don't think it's as big a problem as it was, and I think it's a problem that will diminish. But I don't know whether you want to...
I mean, certainly the retail violence is of concern and been well publicised. It's not. It's clearly a policing issue rather than a trading standards issue. I guess it needs to be not the violence needs to be supported activity to make sure that everyone understands what's being done and why it's being done, that there is a policing response, if possible, where there are issues. And I know local authorities work through community safety partnerships and things like that in local areas if there are particular incidents. Again, it's not specifically a trading standards response, but local authorities and local police forces will work together to do their best to address these things, because nobody wants anyone to be threatened with violence.
Thank you.
Call Sadiq Al-Hassan.
Thank you, Chair. So, thinking specifically on vapes, do you feel this bill goes far enough in providing tougher regulations and more resources for enforcement, but while balancing the burden on businesses that probably haven't had this level of regulation?
Well, we think it does. I think you've got to look at the package, because you've not just got age regulation, you've not just got display and promotion regulation, you've also got the proposal for licensing, which, by the way, we don't see trading standards being equipped to do. That's a local authority business. As I say, a former local authority man, I'd have to say, with the resources, because there's always a danger that you give local authorities more power but you don't give them the money. So you've got regulation, you've got licensing, and you've got registration of products. If you put all of that together, then I think it's quite a powerful package. But it does need to be backed up with the resources, because it's delivering it that really matters. You know, we're all used to legislation which sounds great and never gets delivered.
Yeah, I think I'd agree. We think the balance is there, hopefully with good communication to businesses. Again, in a similar way, this is certainly those businesses that are already involved in sales of alcohol, sales of tobacco, sales of other, well, alcohol and tobacco in particular. This is not going to be entirely new territory for them in understanding where to go for support, the kind of controls that are in place. I think certainly as well, if the changes are made to the product registration scheme, which should make it then more effective for businesses to be able to check that a product they're stocking is legal and compliant. I think those two things, as Michael said, if the package is right, it shouldn't be too complex for businesses to be able to comply with it.
Okay, thank you.
Osborne.
Yes, thank you, Mr. Chairman. Two questions. So first of all, just around digital taxation. I understand in the previous government in March, it was that vapes were going to become digitally registered. There'll be digital tax that should make it easier to identify fraud and misaligned products effectively. I'm just wondering if there was any commentary around the implementation of that. Have you seen that come forward? Are you working with HMRC around the sort of digital tax regime around that? And do you think that that's important in your job to reduce fraudulent product? And second of all, in the United States, the milligrams, you can have products up with up to 60 milligrams worth of nicotine. That's a standard product in the United States. Is there an awareness in the UK? It's 20 milligrams, so significantly less. Is there an awareness within trading standards just around some of the key markets that we're aligned to, just how much we're potentially being out of kilter in terms of we're significantly lower than other major economies? So do you think that therefore we might have a problem with perhaps product coming in from other sources which is not the same as tobacco? And is that a concern for your department?
I'm going to pass that one to you if it's not unfair. I think on the first point, you're right that we think that's going to make it easier. That's going to make regulation and enforcement easier. But on the second, I'll have to leave it to you, I'm afraid.
Yes, just to reinforce Mike's point around the digital stamps, I'm not close to this myself, but I know some trading standards colleagues who are operational experts in this field are working in response to the various HMRC consultations about the implementation of excise and tax stamps and those things. So I know those conversations are happening, and I think the view is that that kind of simple identification is really important for trading standards. In terms of the 60 milligrams versus 20 milligrams, I'm afraid I don't have any detailed knowledge of that personally, but certainly I would anticipate those kind of challenges and issues would be built into the guidance and information being put to officers and any planned training programmes once we know the final forms of the bill and the excise duty and all of the other changes that are coming over the next couple of years as the bill and other legislation progresses. So I'm sorry I don't have the detailed answer.
But we can get it for you.
Thank you.
Okay. Ewan Steinbank.
Thank you, Chair. Just want to ask if you see any challenges in the enforcement of both advertising and display of vapes in shops, especially local grocers, more generic stores rather than bespoke venues.
I don't want to sound complacent, because I'm not. But I mean, this is something again that we're used to doing. So we don't see that as a major issue, major problem. That's what we do.
Thank you. My second question is probably digging more into the illicit online vape market that you referred to. Is the issue more the structure of enforcement that you were discussing, or do you have any concern about online vape retailers' age gating policies?
No, it's about enforcement. The point I was making was around enforcement.
And to add to that, as part of the programme that DHSC have been funding for the last 18 months, we tested out a number of issues, and one was online. This was underage sales. And we tested, I think there was 312 purchases, and there was a 10% failure rate, which was significantly lower, actually, than premises-based sales. So there were a lot in the web platform, their corporate website design, to try to ask the right questions and kick purchasers out. So it is very much about the who does it and who takes responsibility rather than a major problem itself. We also work quite closely with the Advertising Standards Authority, and they do a lot around the obviously broadcast and published media and website compliance and claims and that kind of thing. So that's quite a well-established mechanism for enforcement. So it's the structure of enforcement, as you rightly identified.
It's worth pointing out probably, although it's not relating to the online point, that I said earlier we carried out last year 4,000 test purchases. 26% of those were failures. So compared to the 10% online, it's significantly higher.
Thank you.
Some of the other changes that are going to, is a very practical point, that are going to happen will make it easier for us to do test purchasing, because at the present moment we can only use children, young people, so we have issues of safeguarding. We can only do it at certain times of the day, so it will actually become easier in that sense for us to enforce the legislation.
Thank you. Thank you, Chair.
Okay, call Mary Kelly-Foy.
Thank you, Chair. We did hear from one of the previous speakers that young people see most of the advertising for vapes in shops, in the shops, and one of the bill will bring in powers to regulate vapes, but including advertising. So how do you envisage that the ban on advertising will be enforced on the high street, locally in the small shops?
Well, it'll be enforced in the same way as we enforce it for tobacco and we enforce it for other things. This is not new. I mean, we have trading standards officers employed by local authorities are constantly visiting premises and will therefore deal with any offences that are being committed. They also have their own local intelligence networks. I mean, we can't afford, because we don't have enough staff, to just have a random system where we pop in every now and then. We depend on people giving us intelligence. Some of those are members of the public, some of them are other agencies. So we try and target what we do. When you visit a shop, and how many? 60,000 outlets, something like that. Then you can see whether or not the legislation, the current legislation, and future legislation is actually being implemented, and we can take action if it's not.
I guess
against the retail.
In case you, sorry, you may want to come in. I guess I was basing that on the fact that you did say at the beginning that trading standards have been cut by 50%, so I know local authorities will struggle. And I also know that once there has been a penalty put in place, 6 months later that same shop is doing exactly the same thing again. I'm just so I guess the question is about the resources that trading
absolutely
standards.
No, I was going to say if you're making a case for trading standards to have more resources, I'm absolutely with you. I think trading standards do an amazing job with very limited resources. There is a borough in London now that has no trading standards officers. That is a great worry, because what we're there to do is to protect consumers in all sorts of ways, but we're also there to try and establish a fair marketplace. So we're actually working on behalf of legitimate businesses, and a lot of retailers want to support us in dealing with bad practice in their competitors. So we need more resources, but
And I think to add to that is saying that there's clearly the responsibility is on businesses to comply with the law first and foremost, and the hope would be the vast majority of those outlets would be, because they'll either be part of bigger businesses that have corporate structures to ensure compliance, or they'll be part of trade associations where that training and information and generally, most people do want to do the right thing. What that does mean is that those resources and the additional resources are necessary, but they can then be focused on those sectors where there is intelligence from consumers, from enforcers, and also from other businesses. Businesses will complain, rightly so, about competitors who are flouting the law. It enables that targeting rather than sort of trying to feel the need to inspect 60, 70,000 premises where that would not work and doesn't need to work like that.
And local trading standards officers know where the retailers, where the problems are. I started my career doing prosecutions for trading standards, so I know a bit about how they work on the ground, and they know where to target their efforts. It's also, I should point out, there's a committed workforce here, and we did a survey recently of the workforce. 80% of them supported the legislation, so it always helps.
Yeah, thank you.
In the final quick question from Jim Dixon, and then we have to close for the next panel. Jim.
Yep, thanks very much. Tobacco companies, as we know, collect a pretty rich data set on their sales. Do you think requesting them or placing in legislation an obligation on them to publish that sales data will be a useful tool for trading standards?
I can't say it wouldn't be useful. There's not something certainly not something that's come across my desk.
No, mine either, but as you said, intelligence-led enforcement means the more intelligence available, the better one is able to target. So I don't know exactly what tobacco companies collect, but generally any intelligence is useful.
Great. So can I thank both panellists for their evidence today, and we'll move on to the next panel. Thanks. Okay, if everybody's settled down, we will now hear oral evidence from Inga Becker-Hansen, the Policy Advisor for Retail Products at the British Retail Consortium. For this panel, we have until 3:50, that's 10 to 4. I call the first member who may wish to speak, Dr. Caroline Johnson.
Thank you, Chair, and thank you for coming this afternoon. Welcome. Just a few questions. The first one is, what do you think the challenges will be facing business in implementing these new age of sale regulations?
So firstly, good afternoon. Thank you for the opportunity to speak. In terms of the age verification, that was the question, right? Sorry, it's a bit quiet for me here.
Sorry, it's implementing. What are the challenges in implementing the new regulation?
So I think one of the key challenges in terms of the age verification is this idea of the rolling age for the smoke-free generation. I think at this point it's quite identifiable in terms of those under the regulation are 15, but give it 30 years' time, if you have someone who's 45 versus 44 on the date of January 2009, it may lead to ID for each sale of a given product, if that makes sense.
Yeah.
This will eventually lead to potential points of sale can be a flashpoint for violence and abuse against retail workers and shop workers as well. So it's a real concern for retailers that that could be a real issue in the future in terms of the smoke-free generation and the ageing of that generation in the future. We'd also like to highlight that the idea of a digital ID could possibly make things a lot easier. We know that DBT are kind of promoting the use of digital ID for alcohol consumption, and whether that could be included as a kind of means of age verification, just to make that process easier for the average consumer or the average public member.
Thank you. Can I ask you about staff training? Obviously, once this legislation goes through, which we expect it to do, retailers up and down the country will need to ensure their staff are properly trained to follow the law. One of the challenges they will have, not initially, but as it goes forward, is identifying how old individuals are. Are you aware of any training that helps staff members to identify which people are under, say, 30 or 40 years old?
Specifically under 30 or 40 years old, I think we don't really have something specifically for that at this point. I imagine with the bill something would be implemented or something directly involved in that.
Everybody to speak louder. The microphones are not very good at picking up the sound, so I'm trying to be a bit more directional into the mic.
Okay, no problem. In terms of age verification for product sale, our members have lots of experience in terms of tobacco sales and alcohol sales of products. They have till prompts looking at date of birth of the customer in store. There is also badges and posters and mystery shoppers which are used as well to ensure that they're compliant as a whole. There's Challenge 25, which has been implemented since 2009, which our retailers are very compliant with. There's due diligence procedures, which are agreed with primary authorities. So imagine in terms of identifying sales under 30 or under 40, it would be a matter for retailers to discuss with their primary authority to identify the best route for that in store.
Okay, thank you. One of my concerns with it is it's quite difficult to identify how old somebody is, and people can get themselves into trouble with the law by not being very good at identifying someone's age, which is going to get more difficult as this goes through. How will the training, the actual licensing schemes, moving away from the age of sale to the licensing scheme, how will the licensing scheme affect retailers, particularly small retailers?
In terms of the licensing scheme for smaller retailers, I think it's more about the administration burden there will be, the costing of that as well. Smaller retailers may not have as much capacity in terms of the licensing scheme. Again, it's quite difficult to comment on it at this point because we don't know the full details. So if the licensing scheme were to be bundled in terms of alcohol and vapes or tobacco are separate, or whether they're together, again, that's all kind of different questions your smaller retailers are going to have to take on board in terms of licensing schemes and what they can or can't provide for their customers. Again, that will affect revenue for your smaller retailers as well, so it's something to kind of bear in mind. Increased bureaucracy, increased costs. We'd like to comment that we would welcome the opportunity to discuss and contribute to the design of the scheme, but again, we don't quite know the full detail, so it's quite difficult to comment necessarily on how it will or won't affect smaller retailers specifically.
Thank you, Chair.
I call the Minister, Andrew Gwynn.
Thank you, Sir Mark, and welcome to the committee. Can you outline to us what are the lessons from the introduction of previous tobacco control policies, for example on age of sale change, which we can consider as we introduce the measures in this bill?
So I think the retailers are quite comfortable with the licensing scheme of tobacco at this point, and that is something I guess we are used to as a whole, if that makes sense. I think one aspect of it is the fact that your larger retailers, for example, who have multiple premises, don't have to worry about individual licenses for those individual premises. That's something we're quite concerned about with the licensing scheme and what that could mean. If individual licenses had to be applied for, that could lead to divergence across a retail brand, which again kind of affects your overall retail image as a whole for customers publicly. We'd also like to highlight that if the licensing scheme were to follow something such as the tobacco licensing scheme, the idea that licensing authorities could approve or deny certain applications, it could affect long-standing, established, compliant retailers, which could lead to a loss of revenue as well for these customers as well. So we appreciate the need for the legislation. We appreciate the need for a level playing field, and I guess that's what we'd encourage through this bill.
Yeah. On proof of age and identification, which is more complex, do you think? Is it to have to work out on a daily basis somebody being over the age of 18 from their date of birth, or is it just being able to see that they were born after the 1st of January 2009?
I think currently retailers are used to the idea of over the age of 18, quite honestly, simply because the tobacco and alcohol sales. The identification of January 2009 is more difficult, as I say, in terms of the rolling age and how that will look in the future. I think currently it's quite identifiable. Currently, I'd say that January 2009 is more difficult for retailers to handle in the future, per se. But
Okay. I'm not sure whether you understood the question that I was asking.
Repeat. Go ahead.
Because if I have a piece of ID that shows clearly I was born after the 1st of January 2009, that's very simple to understand. If I say I was born on the 4th of June 1974, I mean, it's obvious that I'm over 18. But if it was 2004 rather than 1974, you'd have to calculate in your head what my age is.
Yes, that's true. It's just the idea that currently that is true, but in the future, if somebody walks into store and they're 45 or 43, I wouldn't be able to tell that at face value by somebody walking into the store, I guess.
But from their ID you would?
From their ID you would, but then that raises, I guess what I'm trying to say is it raises the thing of eventually becoming no ID, no sale, which is a concept which retailers would have to follow, but also it would mean that consumer-wise, you'd require a consumer-facing public awareness campaign to kind of identify and illustrate that to the general public that it's no ID, no sale per se, if that's the angle that government is focusing upon.
So how can government best support retailers to implement the changes in the bill?
So ideally a cohesive guideline illustrating to retailers how to implement the legislation. We'd also encourage alignment across the regulations in terms of new regulations coming through, such as secondary legislation on the licensing scheme, consultations on any secondary legislation so that we may contribute our ideas, both from larger retailers and smaller retailers. But ideally, it's constant communication, I guess, with industry to understand how these changes are made, as well as a public awareness campaign so that the public is aware of the changes and in doing so hopefully reduce any potential violence or abuse against retail workers.
Then finally, I can assure you there will be consultation with the sector, but what would you want to see from a licensing scheme, and are there any lessons from, for example, supporting the implementation of alcohol licensing?
What would we like to see in a licensing scheme? We'd like to see it as a level playing field whereby both small, independent, larger retailers are viewed on the same level as well. Again, we'd encourage the multi-stores to only require one licence rather than looking at individual premise licences, because that will make things more difficult. In terms of the tobacco scheme, I think it's ideally if things could be grouped together so that there is less administrative burden, so that there is less cost for retailers, so that if the aim is for the government to transfer from the idea of selling tobacco to people to selling to vapes because of the health benefits, that transition is made easier for retailers to do. By adding on an additional licensing scheme with additional costs and a separate administrative system, it makes it more difficult for retailers to be able to handle those things at the same time, particularly for smaller retailers and independents as well.
Thank you, Chair.
Okay, I call Sadiq Al-Hassan.
Thank you, Chair. We talked a little bit about like the new licensing schemes' impact on retailers, and you've talked about a level playing field. When you say that you think that large companies should have one license across multiple branches, how does that balance the risk that these measures will then disproportionately impact small and independent retailers, who will then also have to apply for a license for every individual premises?
It's a bit difficult for me to give you specific details, but I guess in initial response, my thinking would be it'd be a discussion between retailers and their primary authority and how that's kind of handled, bearing in mind smaller retailers versus larger retailers. But I'm happy to follow up in writing and give evidence that way, but I can't give specific details currently.
Well, thank you. Is it all right to follow up? Well, just from my point of view, if I had, say, one shop, I would have a larger burden with an individual license than if I had, 1,000 shops, I have the same burden. That doesn't seem to balance, kind of on the proportionality of it. Do you think that's the best way forward, to have one license for large groups and one license for small shops?
Again, I can't give a conclusive answer at this point, but I do think if you have different shops under one retailer who have different licensing schemes, it kind of devalues customer confidence in terms of the products they're selling across the country, if that makes sense.
I can understand how it would increase complexity for the large retail organisation, but I can't understand how it will individually affect confidence of an individual consumer who goes into that shop.
Okay.
Would you like to explain how it would affect the confidence of the individual going into that shop?
I mean, if you have certain branches of a certain brand selling alcohol, for example, in one shop, and then in another shop they're selling alcohol and vapes perhaps, then when you're going to purchase your product, you'll think, oh, okay, I'll just pop to the shop. But they may not have exactly what you need. But if you see it as a national product per se for the brand, then you have that confidence in going into the retailer.
The only thing I'd say to that is I can go into a small Tesco's and they sell different things than the other small Tesco's.
Precisely, but then it should be up to the business or the retailer to decide that strategy for themselves rather than it being implemented, I guess.
Okay, thank you.
Do you believe the measures in this bill prevent e-cigarettes appealing to children? such as restrictions on advertisement, display and flavours?
It is difficult for the BRC to comment on this, given that we're not public health experts, nor are we behavioural economic experts, and therefore I'd ask to confirm this with public health experts rather than the BRC.
Okay. Do you think the restrictions, could you potentially articulate some of the challenges that the BRC may face with the restrictions on advertisement, display and flavours?
So in terms of the restrictions in the advertising, I think some of the challenges in terms of that will be the point of sale in terms of products for some retailers, but also there is a query from retailers as to, in terms of recycling schemes of vapes, how that can be implemented if it can't be advertised, and how the bill or the government can support recycling initiatives alongside the reduction of advertising of vapes themselves, how that can kind of be supported. In terms of restrictions on the advertising, retailers are appreciative of the need. Again, it's this idea of creating a level playing field amongst all retailers rather than focusing on a specific.
Well, thank you very much. And I think for good retailers, it's clear that they will have an interest in making sure age verification schemes are followed. So I think at the moment there is clearly a concern around child vaping. Obviously not asking you to comment from a public health angle, but do you think the problem with child vaping access is currently coming predominantly from proxy sales, that being somebody over the age of 18 purchasing a vape, a tobacco product or another nicotine product and giving it to somebody under the age of 18, or do you think it's predominantly coming from underage sales?
Again, I don't have specific details, so I can't really comment, I'm afraid. Okay. Happy to follow up in writing.
No, thank you. Thank you, Chair.
Final question from John Whitby.
Yeah, do you think there's anything that's missing from the bill that would be beneficial for retailers?
I think the key would be guidance for retailers in terms of implementation, but also how the measures will be carried out. Again, the idea of encouraging a consumer-facing awareness public campaign which highlights the new restrictions as well as the safeguards for shop workers and retail workers, so that when these new regulations go through, the public are aware of the new changes. We'd also encourage that with any new legislation, the secondary legislation, that there is alignment within the regulations themselves, but also across the devolved nations, so that it's clear and consistent.
Okay, thank you.
Please one more if anybody wants to vote up or down. No? Well, can I thank the witness for giving evidence here today, and I ask the next panel to prepare themselves. Thank you. Okay, we will now hear oral evidence from Matthew Shanks, who's the chair of the Secondary Head Teacher Reference Group and Chief Executive of the Education South West Multi-Academy Trust. And for this panel, we have until 4:10. So I call the Shadow Minister first, Dr. Caroline Johnson.
And thank you. Good afternoon and welcome.
Thank you.
We've heard in the past from head teachers and others about the challenges they've faced in schools with vaping particularly. Could you give us an update on the effects of vaping on children in terms of school behaviour management and also its effect on children's education, please?
Quite a large question, but yes, I can give it from an anecdotal point of view and from talking to colleagues around the country. So vaping is a bigger problem than smoking within schools. Children who wouldn't contemplate smoking, sporty children, dancers, etc., engage in vaping because they see it as harmless It is easily accessible. It is something that is very difficult to detect within schools in a way that cigarette smoking is not. It is seen as very fashionable in terms of the way that it is advertised and purported. So we have had instances, I'm not saying this is happening in every school every day, but we can report instances of children going out of lessons to vape in toilets and vape in various places, which is it's very difficult to catch because there is no smell unless they're using some of the bubblegum flavours or grapefruit flavours or other such. So it is having a huge impact on discipline within schools in terms of ensuring children are in lessons and also ensuring that children are in school in the morning in time and not off-site at lunchtime looking for places to vape, etc.
Thank you. And the effect on their concentration or behaviour in class and so on?
Well, it's very difficult to prove what is in some of the vapes, but we have again, there are instances of vapes containing things, other, illegal substances, but it is difficult to prove because of the small size of them in terms of where they can be secreted or hidden. But there's evidence out there of drugs contained within them, snus being contained within the vapes, spice within the vapes, and it being quite addictive, and therefore any kind of addiction leads to misbehaviour, I think, on anyone, particularly when you put that into secondary and into older children in primary schools.
Thank you, it's very helpful. The other thing we've heard about in the past, and in fact one of the teachers at one of my children's schools brought forward a small, looked like a pink highlighter pen. To all intents and purposes, was not a pink highlighter pen, was actually a vape device.
Yeah.
It isn't clear to me why that would be marketed at the average sort of 40-odd-year-old male smoker who wants to stop, or indeed a 25-year-old female smoker who wants to stop. Why would it need to be shaped like a vape? A highlighter didn't make sense to me. It feels to me to be something that's being deliberately marketed at children because it's easy to conceal within the pencil case, and the teachers and the parents can't see that it's there. To what extent do you think the flavourings and the shape of some of these products and the colour of some of these products makes them more attractive to very young children?
So I think, speaking frankly, I don't think those vapes are marketed towards 40-year-old people who are trying to give up smoking. I don't think vaping is marketed towards people who are giving up smoking. It's not a cessation tool. It is a tool to try and encourage young people to engage in something. I've talked before here about it's almost the gateway from chewing gum onto the next stage. You go half a mile down, if you walk down the road towards Trafalgar Square, there's a shop on the right-hand side. I've just passed it walking in. It's full of very colourfully arranged vapes that don't look harmful. It looks like a sweet shop in terms of the way that they are. The marketing a vape and selling a vape that looks like a mini pen drive or a highlighter is only there so it can be secreted and make things difficult in terms of catching students with. We've had instances where the part of the vape can be slipped into the slip bit within a bra, so you can't search and find that, which I was saying before about how it is difficult to know what is actually within these vapes or whether they're actually vaping or not, which leads to confrontation between teachers and children and parents. One of the things that we have found more recently is with the lack of, and they're still fashionable, but we've seen a lack of fashionableness around the single-use vapes because of the impact on the environment and also because there's the hope that those are going to be banned. There's far more reluctance and arguments caused by children and parents not wanting to give up larger vapes because they've paid for them, and therefore that brings into conflict parents with teachers around wanting to claim back their children's vapes. Sometimes those vapes are their parents' vapes, or sometimes they're vapes that they've spent a lot of money on. So no, my view and the view of colleagues that I represent here is vapes are not being advertised to help people to cease smoking. They're being advertised to try and encourage people to take up a habit. I agree with you on that. To what extent do you think this bill will help to resolve or at least alleviate the problem of children vaping? I think at the moment there's a vacuum around an understanding of what vaping is and what vaping can and can't do. I can't talk to the health aspects of it because I'm not a health expert, but it's something that isn't clear. And because it's not clear, it's enabling children to engage in it and parents to encourage children to engage in it. That, again, there are instances of parents giving it as a reward because it's not cigarettes. So therefore they see it, in inverted commas, as being safe. So I think the bill will help that. I think what is really important is the messaging around that and the education around the harm that vaping can do to young people and to adults as well, and actually bring it back to the original reason why vaping came about in the first place, which, as I've said before, as far as I was concerned, was a ceasing smoking. Lots of my friends took up vaping to cease smoking. They don't vape anymore, they don't smoke, but lots of children who would never contemplate smoking vape.
Yes, and just a final quick question on detectors. So some schools I know have tried detector devices to pick up vapor that's not picked up by smoke detectors. What's your thoughts on those? Do you think they're effective? Have they been useful to schools?
Children are very clever and they will find a way round, is what I would say on the one hand. And then on the other hand, far be it for me to sit here as a teacher and talk about funding, but vape detectors would cost money. Smoke detectors are within schools anyway, so it's far simpler. But I think children will find a way around it. I think banning vaping in the same way. We saw a real decrease in cigarette smoking with the advertising, the marketing. I've been teaching for 30 years, and we saw a decrease in that. But in vaping, it certainly is seen. You can't win an argument at the moment with parents or with children about talking about the dangers of vaping. That's the hardest thing.
And so this bill will help with that?
Yes, very much so.
Thank you.
Okay, the Minister, Andrew Gwynn.
Thank you. I think the Shadow Minister's absolutely right to mention highlighter pens. Mm-hmm. You mentioned pen drives. There are examples of vapes that look like mobile phones. There are examples of vapes that are concealed within the hood strings of hoodies so that kids are sucking on their hood strings are often vaping. It's very clear that the industry is being very malicious in its approach to marketing vapes, which is why this bill introduces a ban on advertising and indeed on sponsorship. How do you think that, or do you think that, will have a material impact on dissuading children and young people from vaping?
I think it will, but I think for some it won't unless it has the education behind it as well. I also think it is too easy for children to purchase vapes. It's all very nice to think of shopkeepers not allowing children to buy vapes if they're underage or tobacco, and I'm not denigrating them, but we have instances, for example, of a Year 9 child who had a loyalty card for a vape shop. So she's 13 years of age, and she didn't look 18. And yet she's being sold this at the local shop. You go in and you talk to the local shop. No, of course they haven't. Then there's conflict there, etc. So I think the legality of it and sterner punishment, for want of a better word, for people who are found to be selling. I think the drop box online purchasing also needs to be looked at, that industry. I don't know how, but again, we know that people purchase them from those places. The education side is for parents, because parents and older brothers and sisters are thinking it's safe, so therefore we will give you, a vape in terms of. So yes, I think it will, but I think there's other things that could help as well.
And in terms of other measures in the bill, so obviously advertising and sponsorship is one side of it. Another aspect is going to be bringing in regulations subject to the bill receiving royal assent on flavours and on packaging. Do you think that will have an impact on youth vaping?
Yeah, packaging and flavouring is really important. It's really important. As I said before, it's set out as if it's sweets and it's bubblegum, and why you would need these different flavours, why you are making something that is meant to help you stop doing something more attractive. So if you don't like that flavour, you can try lots of them, and you can collect the different coloured vapes. You can build them up into towers, and absolutely all of those things would help. I think linking vaping with smoking, in terms of you're not able to purchase it as you go up the age range. I think that would also help. I think vape-free zones, I think that's really important. People are vaping indoors. I've seen it today in London, on the tube, other places, in pubs, etc. People are vaping. I've not been in a pub today, by the way. I mean, it's over the Christmas period. People are vaping in pubs in the way that they used to with cigarette smoke. And again, it's not seen as something that is dangerous. So if you put all of that out there, and then you put children into that mix who are looking up, they are seen as, with the colourful packaging, the flavouring, etc. Why wouldn't they?
Yeah. And then in terms of the progressive age of sale, in terms of smoking, clearly smoking rates have declined considerably in children and young people, as indeed the wider population. But do you see that as being also an important tool to help create a healthier generation of children and young people?
Yes, I would. My question would be, why wouldn't we?
Yeah. Thank you.
Okay, looking at the number of speakers we have, number of members who've wished to speak and the amount of time we have left, could I ask members to be short in their questions and the panellists to be short in his answers? Liz Jarvis.
Thank you, Chair. One of the things that I've picked up from my conversation with youth workers and police is that children are being given vapes outside schools. So, for example, if they're not at school for any reason, or if they're particularly susceptible or vulnerable to other influences, they might be given them in the playgrounds or wherever. And then obviously you also have the issue of county lines, and it can be a gateway to county lines as well. How do you think this bill will support education, encouraging children to turn away from vaping? And should this bill be backed by a public health awareness campaign aimed specifically at children and young people?
So I would say yes to the second point, but I would aim it at everybody, because we need to educate parents as well in order to get them to understand. In terms of the first point, I think people who want to find ways of rewarding people to get them to join things that aren't appropriate will find something, and I think vapes are something that are being used at the moment. So I'm not saying that this bill would stop that from happening, because people will always find ways, but it will certainly help the majority of people to see that vaping is not something they should engage with.
Next question from Dr. Becky Cooper.
Thank you, Chair. Thanks for coming along this afternoon. I just wanted to hear a little bit more about the online issue with children and purchasing vapes, or perhaps being influenced to purchase vapes there, and just perhaps your experience as a head teacher and working in schools. How influential do you think that online environment is? And would you like to see this bill sort of develop more to look at that as it goes forward?
Yeah, I think the online area is hugely influential for children. I think it's where they spend a lot of their time, a huge amount of their time. So I think it would be really good if this could look at that going forward as well. In terms of marketing for it, I don't receive any online marketing adverts for vaping, but I'm not 13 years old. But I bet if I was, I would. So I think that's an element to look at.
Okay, Sadiq Al-Hassan.
Thank you, Chair. So you've listed a couple of bits, but do you think there are any other further measures that would help limit the appeal of vapes to children and young people?
I think within that, the appearance of vape shops and location of vape shops, I think is important. So better regulation around that. We've talked about sponsorship bans already. We've talked about raising the age of sale vapes. I think vape packages should have the same kind of warnings that cigarette packages have on them. I really think that's the case, because at the moment they don't. And why wouldn't they? If it's a cessation, you're going to stop that, but you could still get this. So actually, you want to stop that ultimately. That's what we should be aiming for. I think the young people parenting support provisions, engaging in that, because as I say, parents see this as a way of enticing children back into school. Or helping them, or taking away an argument. And you have to appreciate, I'm not criticising parents, because they have a tricky job in terms of getting them back in, and they see this as something safe, and they're caring for their child. So actually, if we make it clear that it's not, and around that, I think that's really important. I've talked about vape detectors would be useful in schools, but wouldn't it be good if actually they were banned? Then they couldn't be. So from that point of view, I think it's important.
Thank you very much.
Okay.
Okay, next question from Tristan Osborne.
Yes, thank you, Mr. Chairman. My question is around price. So in this bill, we're looking to ban the disposable vapes, which, as a former teacher myself, I used to see in toilet bowls and other exciting locations in secondary schools, sadly. Do you think that that's going to have a major impact on perhaps kids not being able to afford these products, and so we'll also see a reduction? Do you think that price differential is going to be an important factor?
So yes, but not on its own. So I think it would help, but people will find a way to get something if they want it. We know that. So the price hike without the education might increase other instances of unpleasantness between people in terms of bullying, bribing, etc., theft. So I think it has to come along with the education. The whole message needs to be that vaping is not something that is for children to engage in. It is something to help people to stop smoking, would be my view and the view of educators.
Thank you.
And Ewan Steinman.
Yeah, it's just a quick question on flavour and colouring. I'm trying to understand the predominant issue with reusable vapes. I'm actually quite surprised to hear that the sort of non-single-use vape, the refillable vapes, are an issue in schools. So I was wondering if you could expand on that.
So it's not that they're not an issue, it's the fact that
I was quite surprised that they were such a predominant issue. I would have presumed disposable vapes were the predominant
yes,
issue.
absolutely. Yeah, a huge issue.
So I was wondering if you could potentially expand on whether those are more accessed in the classroom through proxy sales that have been, a parent potentially purchasing it for them, or whether you're seeing refillable vapes being purchased at the same degree as disposables out in the community under sales.
So I think the reason why the disposable and the single-use vapes are more popular is there's literally less for them to carry, so therefore it's easy to secrete and hide and get rid of, whereas the refillable vapes are fiddly to fill up for a start, so that's something that isn't appealing. You haven't got that speed. I'm conjecturing here around it, but the flavourings and the colours is certainly something that influences and impacts on children using vapes. As I say, I think that the size of the single use and the disposable ones is an issue, but if we get rid of the disposable, the others, so we've said, for example, single-use vapes are banned anywhere on site, so that means parents can't bring them in as well. So what we've seen then in some of our schools is more children bringing in their parents' vapes, and then you catch them with those, and then that's bringing conflict in. That's what I meant behind that. Not to imply people weren't still using them. We just can't necessarily...
No, I completely recognise that, just understand the issues it's following up. I think probably just my final question would be around your assertion that there should potentially be packaging similar to cigarettes. Do you believe plain packaging would be an appropriate balance between that, considering that might potentially deter?
I would, at the moment, I would take anything that isn't coloured and making it look like it's candy. To be honest, in the American version of it, it's sweets, it's there, and when you walk in shops, it's in your face in terms of the way it's placed. It's not behind a screen shutter. So yes, because of, the health benefits aren't known in the same way, but I would like to see a move towards that. Anything that tells children that this is not something which is safe, it's not something that's recreational, it's not something that is a reward, it's not something that's going to help them to have a better life or study better within school because it relaxes them, all of those things.
And do you currently see, probably coming back to my initial point, refillable vapes, a distinction between the way they're displayed within shops as opposed to disposables? I would say I am severely concerned with children, for example, being presented a wall of candy, but I see that probably being more predominantly disposable vapes, or the highlighter pens is
no, so the refillable ones, it's the way that the flavours are displayed as well. Right. It's not just the disposable vape; it's all vaping. So you can go into a shop with a refill, and you can buy 4 different flavours in 4 different colours to refill at a different time, and you all have a different tote on the different type of flavouring, and that's exciting and different because it's a reward. It's pleasant, and it'll help you to be calm.
Thank you, Jeff.
Okay, can we thank Matthew Shanks for his evidence today? It's been very interesting and stimulating for those of us that don't know much about vapes, and I'm sure we'll take a lot of what he said into consideration in our deliberations. Okay, can I ask for the next panel to come forward, please? Okay, now things have settled a bit. Can we welcome Dr. Laura Squire, OBE, who we'll now hear evidence from. She is Chief Healthcare Quality and Access Officer for the Medicines and Healthcare Products Regulatory Agency. Now, for this panel, we have until 4:30, which is obviously 20 minutes. And I'll call our first member who wishes to ask a question, Dr. Caroline Johnson.
Thank you, Chair, and welcome to the committee this afternoon. Thank you for coming. I wanted to ask you about the approvals process that vapes go through.
Yep.
Specifically, people will say, well, this is an MHRA approval or an MHRA tick, as it were, and therefore people in their own mind might think it's therefore safe because you've got medicines in your title. Could you just briefly lay out the processes that you take to regulate processed items such as vapes for commercial sale, how that differs from an actual medical devices regulation, which is the larger part perhaps of your business?
Yes, thank you very much for that question. I welcome the chance to answer it. Because as you say, we are a healthcare products regulatory agency, and that's what we're about. So when something comes to us as a medical product, so it has a medical purpose, for example, something that might be prescribed to help someone deal with the issues of nicotine withdrawal, to help them get off a product. That would be it would actually be licensed as a medicine because the active ingredient in it is a medicine. Sometimes the medical devices regulations come into that as well. And in order to give a license for a product like that, the organisation, the manufacturer that's produced it, will need to give us a dossier which has clinical evidence in it, it has quality evidence in it, all sorts of things which then go through a detailed assessment by our very skilled assessors, some of whom are medics, some of whom are skilled in pharmacy and also looking at quality. What's important to say about that is when we license any medical product, we do not say this product is safe. What we consider is the risks of the product and the benefits of the product, and if the benefits of the product outweigh the risk, then we will give it a license. We always say that the medicines are not safe things, so if you don't need them for the benefits, don't take them. The approach we take on consumer products is very different. That is not an assessment process. It is a notification scheme which we undertake under the tobacco and related products regulations, whereas the thing I've talked about before is the human medicines regulations and the medical device regulations. So under the tobacco and related products regulations, we have what is basically a notification scheme. So the manufacturer of a consumer e-cigarette would have to come to us and show that the product has the 20 milligrams, that it is no more than 10 mils. If for refill containers, the limit is 10 mils. And then there are some limited labelling requirements. But we don't inspect that product. We don't test that product. It's a data check to see whether those things are true, and then it goes onto the register. So it's a very simple notification scheme, which is helpful in terms of having a single record of what's out there on the market, but it is nowhere near the sort of assessment that we would do if it was a prescribed product that was proven to actually help people stop smoking. The other role that we have is once any product is on the market, which is within our remit, is post-market surveillance. So we have something which is called the yellow card scheme, which people may have heard much more about during the pandemic, where anybody can report a problem with a product, and that covers consumer vapes as well as medical e-cigarettes and other nicotine-containing products that we might license. Once we get a report, we do examine all of those reports, and if there is a signal that there is a problem, we will issue safety communications sometimes, and we did that a couple of years ago where there was some evidence of lung damage. But again, we have that role, and often we will cooperate with other organisations as well where there is a need for enforcement. Trading standards we've heard from earlier, and they would do that. So the roles are very, very different.
Thank you. And you've explained that they are a very different role. In one respect, you've checked that they have a level of safety, and the others is do they just notify you that they're following the basic level of rules. Do you think when the customer buys it, the suggestion that it is MHRA approved lends the customer to believe that there's some evidence that these have been medically checked in some way by some higher competent authority that actually hasn't taken place?
I mean,
could it be better, in fact, for some other organisation perhaps to do it, or it to be given a different name when this is when the lower level process has taken place?
Yeah, I mean, I don't have any evidence of that, but it does worry me. It does concern me that we are an organisation that is about healthcare products, about medicines, medical devices, blood products. That's our business. Yeah. And it does concern me that people might think that vapes are safe. And when I talk about risk-benefit, what vapes are safer than is tobacco. I don't think anyone disagrees with that, but they are not safer than nothing. And we don't actually know how unsafe, because there is we need long term. There is a lot more need for studies and understanding of what the damage could be done. So my feeling is yes, I think there is a potentially a misleading position with an organisation like us, which is basically on healthcare products, running this scheme. Yeah.
Thank you. Thank you, Chair.
Minister Andrew Gwynn.
Thank you, Mark, and welcome, Dr. Squire, to the committee. I want to ask two questions specifically about the notification scheme, which you very helpfully outlined to the committee in the response to the Shadow Minister. The first is, what do you think are the most pressing issues with the current notification scheme that you would like to see addressed in a new regulation scheme? Registration scheme?
Well, I think we heard earlier that, which I agree with, that there's sort of the different elements that you need to make something work: licensing, regulations and registration. And I think it was mentioned that registration is important to allow compliant businesses to be able to check that the product that they've got is compliant. The significant problem that we have with the notification scheme at the moment is that there isn't an easy way to take something off the register once it's already there. And that is a problem, because that means that if people are checking the current register, there might be something on there that we would quite like to take off, but we can't. That's not, I mean, there are powers to take things off the shelves, so if there was a recall issue, then that can be dealt with. But the main problem I think we see with that, or the primary thing I think that needs to change, which is in the bill, is the ability to have powers to take things off the register. Obviously we've got to consult on the regulations themselves, but we welcome that change.
And what do you see as the main differences between the current notification scheme and the scheme that the bill creates powers to establish?
I think I think somebody talks about the package actually, and the bill is more than the notification scheme, and I think the whole thing works together to make a much safer environment. So there is, what I was particularly pleased to see is things about a requirement to do studies and a requirement to do testing. I mean, testing is always something that we're sometimes asked about. Testing at the point of registration is one thing, but you need to know it stays compliant. So I think it will. Obviously, there's got to be consultation about exactly what's going to go into the regulations, but I would expect that there would be an awful lot more linked to the other requirements of the bill, and that will make it tighter. So I think that will be an improvement, because at the moment it is very light touch.
Thank you.
Okay, I call Tyrone or TV.
Thank you, Chair. Thank you, Dr. Squire. Just wanted to know what effect you think the bill is going to have on the number of vaping products that the MHRA will have to approve through their licensing route.
For a medicines licence?
No, for medicine licensing route.
Yeah. I mean, that's a difficult one. I mean, at the moment, we have had one product that was given a medicines licence in 2015, but it's never been marketed. And we continue to try and encourage people to come forward to get medicines licences. The reality is, though, there is such a huge discrepancy between what you can do with a consumer product if you're a manufacturer to get it out there and get it on the market compared to what you would have to do to get a license for it as a medicine. And that's quite right. I think what this scheme does is it makes it more demanding to be a manufacturer of a consumer product and puts more requirement on it, which to a certain extent reduces the differential between the two, which is welcome. But we really continue to encourage people to come forward and talk to us about licensing products. I think one of the things that will be interesting is what impact this has on the narrative out there that was being talked about by the previous witness about vapes being safe. I think this will perhaps change that narrative and make people realise. So we stand ready, is all I can say, for more applications for medical licences. We put out some detailed guidance in 2022 to try and encourage manufacturers to do that. And we do actually have one, I think, coming through in the pipeline at the moment. So it'll be interesting to see, but hard to predict.
Can I just ask one more question around the capacity of MHRA in terms of being able to handle the amount of the increased workload that the new legislation require?
So in terms of at the moment, with the current notification scheme, we have the resource we need to do that. I would expect that as the registration scheme becomes more detailed and more demanding and there's more in it, that will require more resource. But that is something that we need to continue talking to the Department of Health about as they're developing the policy, and we will do that. And of course, there is also part of that, the impact on us will depend not only on what's in the regulation, but also who does it. And I know there are conversations about where it is best done, and there are registrations for other consumer products which already exist, and so conversations happening with the Office of Product Safety and Standards, and so I think to learn from those sorts of schemes that are already happening. So that's a Department of Health and Social Care policy decision where that goes, and we will continue to work with them. And I think that would also involve being clear about what resources we might need if that we carry on and need more of those. But at the moment, we have what we need to do what we need to do under the current law.
Brilliant, thank you.
Sadiq Al-Hassan.
Thank you, Chair. So when we give out a new medicine to somebody, we give them advice and explain to them what it is and, you know, what's safe to do with that. Do you think when people get vapes, they get the right level of information and advice about what that product actually is with the risks?
They would do if it was a licensed product, but and that,
I thought you said there's no licensed product.
There are no, which is why that is the way we would prefer to do it. But these consumer products, we don't have, again, if we license something as a medicine, there are very strict requirements on labelling, on what needs to be given to the patient in terms of understanding what the product is and the risks of the products. That isn't there with these consumer cigarettes. It's going to get stricter, I think, under the new rules, but you know, my preference would be that we give people more information.
Thank you.
Zubair Ahmed.
Thank you, Chair. Thank you, Dr. Squire, for being with us. The Royal College of Physicians has called for manufacturers to limit the production of toxic substances from vapes and require the MHRA to independently verify some of these contents of e-cigarettes. Do you think, as the bill currently stands, this can be achieved through measures in the bill?
I don't think it. I mean, it depends what happens with the actual regulations. But at the moment, we don't have powers at the moment to test consumer e-cigarettes. That's a requirement. That's a power that sits with trading standards. Again, I would say if we measure it, if we license it as a medicine, then we go into absolute detail of what's in it. But I think. At the moment, it depends on what's in the regulations that come round. But we don't do testing at the moment. We'd have to think about. I think it would be important to think about the point at which any testing was done, because if it's done at the point where it goes onto the register, that's fine. That tells you that the sample we saw at the point at which it was registered was compliant. But what happens later down the track? So I think it's really important, that role that trading standards have to do that testing is really, really important, because they can do it post-market at any point. But I think the question really is the role of the MHRA, which is a medicines and healthcare products agency, getting deeper into these consumer products where the risk is not outweighed by the benefits. And that is an uncomfortable position for a medicines regulator.
Thank you. Thank you, Chair.
So, it seems in a couple of your answers, and thank you, Chair, that you've kind of almost putting the point that maybe a vape should be a medicinal product. Is that the MHRA's view?
I don't have a view of whether a vape should be a medicinal product. I think I have a view on the role of a medicines and healthcare products regulatory agency in regulating products that aren't medical products, which is a little bit confusing, I think, at the moment. But when something is a medical product, like, as I said, any medicine, you wouldn't take it if you weren't ill, because then the benefits are not outweighed by the risks. So that's really my point, that we have a role I am pleased to see the strengthening of this. I think there are conversations still to happen as the consultation goes through. We understand exactly what the new registration scheme will involve, as to the best people to do that, to give the right message out to the public.
Okay, thank you.
Okay, are there any more questions to this panellist? If that's not the case, then can I thank Dr. Squire on behalf of the committee, and I'm sure a lot of your evidence will be taken into consideration. Thank you very much indeed. Can I now ask the next panel, the 10th panel, to take the chair, please? Okay, with us for the 10th panel today is Professor Steve Turner, President of the Royal College of Paediatrics and Child Health, and Professor Sanjay Agrawal, Special Advisor on Tobacco, Royal College of Physicians. And for this panel we have until 4:50, i.e. 10 to 5. I call the first member, who's usually the shadow spokesperson, Dr. Caroline Johnson.
Thank you and welcome, and I should reiterate that I am a member of the Royal College of Paediatrics and Child Health. The first question is about the harms, the medical harms of vaping. What do we know? We know that these products are relatively new and it took quite a long time to establish how harmful smoking was. What do we know about harms that may be caused to children who have never smoked by vaping?
Thank you very much. I'll take that. And thanks for accommodating me. I've flown a long way. Thanks to Professor Bull for reshuffling the order. I'm very passionate about this and grateful to contribute. Vaping is harmful for children. The evidence is accumulating. Vaping contains nicotine, and nicotine is harmful to us as human beings. You've heard previously from Matthew, from the Head Teachers Association, the impact of vaping on their education. And there are evidences of children coming to harm from vaping devices bursting into flames. There's a lot of talk about something called popcorn lung, which fortunately is very rare but is very serious and can affect children who vape. So collectively, there is already a substantial burden of evidence that vaping is harmful for children.
Thank you. We've heard a bit today about the marketing of vapes and the flexibility of industry to maintain its market in the nicotine-addicted people. Do you think this bill is sufficiently flexible enough? We've seen, for example, the development of these nicotine pouches becoming more popular with children, and we've again started to see these advertised in brightly colours, in flavours like groovy grape and Whitty spearmint, and the sort of same sort of patterns that we saw with vaping and that have been described today. Is this bill future-proof enough to stop those sort of activities?
Yes, if I may go first. We as a college, and we have 24,000 paediatricians in the UK and overseas, so we're a substantial college. Strongly support this bill as it is. We believe that it provides the right protection for the most vulnerable members of our society, i.e. our children, our future, and is proportionate. So yes, we think the bill, as it stands, addresses all of the concerns and others that you've just raised.
Thank you. Professor Agrawal, do you have anything to contribute about the effects on older people vaping?
So the majority of adults who vape have smoked. So they are using vapes to quit smoking. Research that looks at populations who have never smoked, who have only vaped, is actually quite small. The longitudinal studies are still not there. We know from shorter term studies vaping can lead to things like coughing and throat irritation. But it's really important to consider the alternative, and that's continued smoking. Just in my professional practice, 30 years roughly of qualification, I estimate about 3 million people have died in the UK from smoking tobacco. The intensive care unit that I work in, the lung cancer clinics that I do, are full of people who have come to harm from accrued smoking. So there should be no doubt that actually smoking combusted tobacco is the key thing that we want to prevent future generations being subjected to. And there are 6 million smokers still in the UK, and we need as many of them, and to help as many of them as we can, to stop smoking. And vaping is one means by which they can stop smoking, which is really important.
Thank you. That's really helpful. I wanted to ask you about flavours as well, from your experience of people who are trying to quit. There has been some debate about restricting flavours or not restricting flavours and how it entices children, but perhaps it helps adults. When I first met with somebody from the industry, I asked them about the flavours, and what they told me at that point was that when somebody uses another quitting aid to stop smoking, they will use the quitting aid and then they will stop the quitting aid, and then they're not using any products or buying anything or making any revenue for the companies. But that when they have a choice of flavours, they don't just give up smoking, they transfer their addiction to another product which they then continue to buy because it's enjoyable to vape these different flavours and choose different flavours from different times if they get bored. Is that something you've seen in your clinical practice? How do vapes compare to nicotine patches or gums or other inhalation devices that are just a nicotine compared to vaping for both two things really? One is giving up the smoking, and secondly is persisting with the new habit.
So there's a few things to unpack there. So firstly, I would say that a lot of people who smoke, who want to give up, use vapes because they've tried other products and haven't been able to give up with other products, be it NRT or tablet pharmacotherapy. And one of the things that they want to get away from is the taste of tobacco. And by having flavours, it allows them to get away from that. And actually other NRT products like gums and lozenges also have fruit flavours, it's not just vapes. So flavours are an integral part to helping people get away from smoking. Now, equally, I would say that flavours, as we know, attract young people to smoking. So I think it's really important that we limit the number of flavours, but perhaps what's more important is the flavour descriptors. And I think we need to make them bland. And the bill, as it stands at the moment, provides powers to restrict all sorts of elements related to vaping, whether that's the number of flavours, but also the descriptors and the packaging and the appeal and the advertising. So having bland descriptors, I think, would be really helpful, and eliminating flavours that we know are popular amongst children.
Thank you. And just a final question. That leaves the government with a difficult choice, doesn't it? Because there's a whole plethora of flavours at the moment. You can make the descriptions boring very easily. But if you're going to choose a small range of flavours, presumably the intent will be to choose the ones containing the chemicals that are thought to be the least harmful. Is there evidence that enables you to choose which flavours may or may not be less harmful?
So, firstly, there's good survey evidence of what is popular among adult smokers who are using vapes to try and quit, so that's one helpful factor. And then of flavours that potentially might be associated with the harm, cinaldehyde is one that's been associated, so that would be one, for example, that you would remove.
Okay, but there's no specific, you don't have evidence that compares sort of, well, say that the popular flavours are cherry and raspberry, you don't have anything that says which is safer?
No.
No. Okay, thank you. Thank you, Chair.
Andrew Gwynn.
Thank you, Mark. Welcome both to the committee, and thank you for your time. You've already outlined, in answer to the Shadow Minister, some of the early impacts that you're seeing on patients in terms of vaping, but of course I'm interested in smoking. Tobacco is a killer. And I just wondered, following on from the evidence this morning from the CMOs from across the UK, what impacts of smoking do you see in your patients? And I include second-hand smoking in that analysis as well. And what difference do you think the measures in this bill will make to that?
So smoking is bad, whether you're an active smoker or a passive smoker. Sadly, there are lots of children who still actively smoke, but there are many hundreds of thousands of children who are exposed to second-hand smoke in the home. And there is undeniable evidence that exposure is harmful. I do respiratory paediatrics, and asthma admissions are very common and are clearly associated with exposures. And if you look at natural experiments, such as in Scotland, we have the Take It Right Outside, which was a smoke-free homes initiative. After that, there was a reduction in the number of children coming into hospital. When we brought in Scotland in the car smoking ban, there was another reduction. So on that whole population basis, there is lots of evidence of benefit to the population, and particularly children, from smoking interventions. There's also benefits in terms of birth weight of children after that. So there's no doubt there's a huge amount of harm from second-hand smoke, and anything that reduces the population's exposure to second-hand smoke will benefit the whole population. And as we heard earlier on from Matthew, the head teacher, it's part of a package, and it's part of education as well. So smoking continues to be something that children shouldn't do. Children should never vape. Children should never smoke. They continue to do so. And anything that we as a responsible society can do to stop that is to everybody's benefit.
Now, some are arguing that the extension to outdoor settings of smoke-free legislation, and of course it's subject to consultation, but in England we've made very clear we will be consulting on children's playgrounds, schools and hospitals. Some have argued that the current argument of the public health test that is in the 2006-7 legislation should be applied going forwards. Given that children's playgrounds almost certainly would not meet that threshold, what's your argument in terms of protecting children from the harms of second-hand smoke?
Yeah, I think children are very susceptible and can be very easily influenced, and they're learning all of the time. And if they see a social norm that it's okay to go to a football match and to smoke, to watch your child's football match and smoke, to smoke outside of a pub, then they will very quickly adapt and think that that is a social norm. So I think there's a powerful social norm exercise there. What do we as a society expect is normal? And approving smoking outside of hospitals seems to be such a bad conflicting message. So I think that argument in itself, to me, is very powerful. And I do think that there were a number of people back in the early noughties who felt that the smoke-free legislation probably might not have much benefit. It won't have any benefit on pregnancy. Why on earth would that reduce birth weight and premature delivery? Well, it did, and I think that's probably the snowballing of stopping smoking in pubs, for example. I think the whole of society changed their attitude and behaviour around smoking. So going back to the original question, I think putting restrictions in public spaces will change that social norm to everybody's benefit.
And then lastly from me, the bill seeks to reduce youth vaping. How do you think we best achieve that whilst not deterring adult smokers from quitting?
Yeah, that's a really good question. And I think the balance in this bill between supporting the 6,000 smokers to quit and not engaging children in nicotine addiction is the right balance. I think that, going back to what I was saying earlier on, getting the message across to young people is a multifaceted intervention that requires education as well as the legislation. But it is a really difficult balance. But I do believe that the bill as it is has that balance just right.
Thank you.
Can I call Dr. Danny Cheeseman?
Thank you, Chair. Thank you, Dr. Muller. I'm from Aberdeen. I've worked there for a few years, so I know it's a long way. But as a consultant respiratory specialist in paediatrics, what we've been trying to do is just get asking some panellists just approximately what it's costing the NHS. And I just thought, in your clinic doing respiratory paediatrics, what proportion of your patients are in some way involved with smoking or second-hand smoking?
Yeah, so the impact to the whole of society of second-hand smoking in children is complex, but the various pieces of the jigsaw are, first of all, children come to clinic, children are admitted to hospital, children come to the emergency department and go and see the GP. So there's that healthcare thing. But if any of you have children, when your child is off school, that has implications for you as a family. There's some difficult discussions over breakfast, who's going to go to work and who's not. So there are a number of different impacts to us as a society, economically and to the NHS, from second-hand smoking. And I'm not clever enough to put a number on it, but it's a lot bigger than I think people know. But what I do know is that £46 billion is a number that is almost too big to consider, which is the cited direct health cost to the NHS of smoking. But I suspect the wider societal cost will probably be a magnitude greater than that.
And just a ballpark figure, just for a general day when you've got a list of paediatric respiratory cases, what are they, 10%, 20%? Do you think?
The children with respiratory symptoms are overrepresented by children who are exposed to second-hand smoke in the home. And parents don't want their children to smoke. The parents feel torn, they're conflicted, they're addicted to nicotine, they don't want their child to smoke. And having a smoke-free generation will address that almost impossible parental conflict.
Thank you.
Okay, John Whitty.
The bill makes it illegal to sell vaping products to under 18s and to proxy buy vapes for children, but it doesn't make it illegal for under 18s to buy vapes. So what is your view on that?
I support the bill as it stands. I think that the onus has to be on the vendor not to sell and not to criminalise the customer or the child.
Yeah, what I thought you'd say. Thank you.
Okay, thanks. Alex Borosh-Curtis.
Thank you, Chair. I think the professors have probably answered the question. I'm going to ask it anyway, based on the way in the evidence you've given to colleagues. Recognising, I think, what you've said in terms of how you feel the bill overall, the different kind of methods it's trying to employ strikes the right balance. Is there anything else that you would still like it to do? And I'm turning particularly, obviously, on the idea of vaping here, given I think there's pretty unanimous agreement on the tobacco side. So just in terms of the vaping element, is there any more you think it could do? Not necessarily in terms of as a cessation tool and supporting the transition from those from smoking, but in terms of prevention, to prevent people, and obviously children aside, but just preventing even adults from beginning that journey and vaping in the first place.
Well, from my standpoint, the online harms, for example, through social media, through gaming, through music videos, there's lots of depictions. It's a wild west out there with respect to both tobacco, actually, and vapes that lure people in. So there's a lot of advertising and promotion of both tobacco and vaping products. And I think the one area that we could do much more with is that online and social media area. That would strengthen the bill further.
Thank you. Thank you, Chair.
Okay, Sadiq Al-Hassan.
Thank you, Chair. So vapes really kind of started in the UK around 2010 from what I remember, but do you think that the bill is sufficiently future-proof for the next, evolution of nicotine or tobacco or oral tobacco products? So whatever's coming next, do you think the bill's got enough to protect us from the next thing?
So firstly, and I've not yet had a chance to say this, but I think that the bill is really well balanced, it's bold and it's world leading. And as part of that, all nicotine products and also non-nicotine containing vapes are part of it. So I think the people that put this together should be congratulated, number one. But we also have to be aware that industry never sleeps. It will try and adapt to regulation and legislation, and we need to be wary of that and make sure that we use the powers in the bill in the future depending on how industry responds. So for example, disposable vapes, which are due to be banned later this year, I'm sure that there'll be a lot of companies right now changing their products to make them look as though they're not disposable vapes, when in fact, all intents and purposes, they are disposable vapes. So there will be lots of adaptation by industry that we have to be wary about. And I think this bill provides those future powers for us to adapt to industry.
Thank you.
Mary Halliford.
Thank you, Chair. As we know, we have very high levels of child poverty in this country, and much of that poverty is in the areas where there is high smoking prevalence, as well as many other health issues. How important do you think this bill is in terms of the health of children as they grow into adulthood, and the impact that will have on the communities that they live in and in addressing inequality?
Yeah, so thanks. I think, touching on what I've said before, I think that there are communities, and they're invariably in the poorer communities. There's something called the tobacco map, which if you look at the areas where the tobacco use is greatest, it maps totally on top of deprivation. So we have an opportunity here to break that intergenerational social norm. It's okay to smoke. And the people who come to the greatest harm from cigarette smoking and from nicotine addiction are invariably the poorest. So I think what is proposed here will be a good step towards narrowing the divide that we see in this country in health outcomes that's totally determined by poverty.
Can I add to that? So, we estimate there's around 350 children a day who start to smoke. And a lot of those will be from the most deprived communities. In addition, smoking in the UK brings around 250,000 families into poverty, and those families have children. So this bill is going to go a long way to not only reduce the health harms to individuals, it will reduce poverty, it will hopefully reduce smoking-related deprivation. To answer one of the questions earlier about the cost of smoking to the NHS, well, it's estimated it costs secondary care about £1 billion per year, with primary care in addition, that's a total of £2.6 billion to the NHS in total, around £20 billion a year to social care, and about £50 billion a year in lost productivity. So the overall cost of smoking to our society, whether that's at an individual level, poverty, deprivation, social care, workforce productivity, and that's why this bill is just so important.
Thank you.
Jim Dixon.
Thank you, Chair. Some other countries, notably Australia and Canada, have introduced mandatory health warnings for manufacturers to place on individual cigarettes and filters, because quite often, particularly young people, are accepting cigarettes away from packaging. Would you see that as a useful way of increasing the saliency of health warnings?
Yeah. So, these additional measures to firstly warn people away from smoking, those who might be looking at the packagings, or the individual cigarette. Remember, an individual cigarette is an advertisement for the cigarette, and therefore every time somebody takes a cigarette out, and lots of times children are sold cigarettes on a per cigarette basis. They never see the package, actually, they only see the cigarette. So therefore having on cigarette warnings is another measure that we can introduce to warn off people and from the harms of smoking. So it'd be great to see that.
Okay, I was incorrect before. We do have till 5 o'clock actually, rather than 4:50. It is 4:50 now. Do we have any more questions from members? No. In that case, can I thank Professor Turner and Professor Agrawal for giving evidence today. I'm sure it'll be very useful to the committee in its deliberations. And can I call the next panellist, who happens to be the Minister, who instead of asking questions is now about to come under fire from his own committee. Yeah. So, our final witness for the record is Andrew Gwynn MP, Parliamentary Under Secretary of State for Public Health and Prevention at the Department for Health and Social Care. As I say, we've until 5:20 for this, and I call his opposition, Dr. Caroline Johnson.
Thank you, Chair, and thank you, Andy. Right, so a few questions really just to understand the thought process by some of the government's decisions on this. One of the suggestions made actually in the previous Bill Committee, which we were both part of, I think, was made by one of the Labour backbenchers, was of a nicotine-free generation. We've heard today, particularly from the CMO, was about the way the industry flexes to maintain its pool of addicted people, and we've heard before how young people are particularly vulnerable to the addiction, starting the addiction. So you've also talked today about the simplicity and the importance of making it easy for retailers to be able to do these age checks. So why, when you're raising the age of sale for tobacco products, did you make the choice not to raise the sale for other nicotine products at the same time and have one simple process?
So firstly, thank you, Caroline, for that question. I wasn't actually on the Bill Committee when the previous iteration of this went through Parliament, because I was the Shadow Social Care Minister, had been bumped away from Public Health only to return to it in government. But I think the starting point is firstly a recognition that the previous government did bring forward the Tobacco and Vapes Bill. That was incredibly foresighted of them. I thank those, including yourself, that supported that legislation. I think what we've got to be mindful of here is that what we are firstly seeking to do is to make the United Kingdom smoke-free, and smoke-free as soon as possible. As we heard from the chief medical officers from the various nations that make up the United Kingdom, tobacco is a killer. And so our first target has to be driving down the instances of smoking, driving down, as a consequence, the instances of tobacco-related death, tobacco-related illness, and the harms caused by second-hand smoking. And that's why the measures, insofar as tobacco is concerned, are far more weighty than the measures in respect of vaping. I think the other thing that I would like to say in answer to your question, because it is an important point, we are concerned about nicotine addiction, is that we get this balance right. We recognise that vaping is an important smoking cessation tool. As the CMO said, not all countries share that point of view, but in the United Kingdom we see it as an important package to help people to quit smoking. And there has been a very successful scheme in this country, the Swap to Stop initiative, and that is an important part of this. But we are really concerned about the scourge of child and youth vaping, and that is why we think that the measures in this bill are proportionate in that we are tackling a specific issue in trying to stop children from taking up vaping, and indeed to try and dissuade adults who have never smoked to take up vaping. As the CMOs have said, vaping is better than smoking, but not vaping and not smoking is the best option of all. So this is a proportionate measure. As you know, we are seeking quite far-ranging powers, and that is indeed to ensure that across the 4 nations we can react as industry reacts to these changes, so that this bill will future-proof in a way that if we were overly prescriptive, we would then have to come back to Parliament with further primary legislation. So whilst we're not seeking nicotine-free at this moment in time, there will be powers in the bill that at some stage in the future the governments that make up the United Kingdom may seek to consult to go further. But where we are now, it's to stop smoking, to get to our smoke-free targets, and to really drive down and crack down on the instances of childhood vaping.
Thank you. I'm not sure I completely understand your argument, because, of course, the rise in age of being able to smoke will also inevitably raise the age of people who are wishing to quit. And, of course, if a government wants to do it later, you can end up in a very tricky situation where you're asking people to enforce an age of sale of 18 for alcohol, an age of sale of 1st of January 2009 for tobacco, and another as yet to be determined debate for vaping, which could actually make things a lot more complicated still. So I'm not sure about that, but thank you for your answer. My other question is about advertising. You'll be aware that I put forward an amendment to the Conservative bill to try and restrict advertising, because I think it is important to try and restrict advertising to children. But how will health professionals who are promoting vaping as an alternative to smoking, specifically in a medical context, not necessarily on the side of a tube or a bus, but in a medical setting, how will they be protected from being criminalised?
So I think this is an area where this bill really does build on the previous government's iteration of tobacco vapes, and again, take the politics out of it. I want to thank members like yourself that really pushed this last time round. We are able to do this because it was a manifesto commitment of the Labour Party in the 2024 manifesto that we would ban the advertising of vapes and the promotion of vapes in sponsorship, and indeed there is a 75% support for an advertising ban of vapes. In terms of the consequences for vapes as a quit aid and being able to promote vapes as a quit aid, of course you will have read in part 6 of the bill that it is only an offence if advertising is done in the course of business. So that excludes the promotion of vapes for a quit aid, and I think that is something that hopefully you will welcome.
Okay, great, thank you. What was your thought process about shisha and bongs and other sort of paraphernalia that people have raised not being... some people feel that those are not adequately covered by the bill?
Oh, you're going to get me on my hobby horse having mentioned bongs. Well, look, firstly, all tobacco products will be covered by the measures in this bill. So shisha is covered. Shisha is a harmful product, as is other tobacco products, and all tobacco products will be covered by the measures in this bill. In respect of paraphernalia, I have raised with officials and indeed with colleagues in the Home Office what I see as being a potential issue, in that were this bill to become law, as I hope it will, and there is then further consultation on the packaging and display of vapes, we could end up with a situation whereby vapes as cigarettes and other tobacco products are hidden behind cabinets in plain packages, but those same newsagents have bongs in the window. Now, I am assured by my officials that bongs and grinders can also be used for the consumption of tobacco, and therefore will fall within the scope of the measures in this bill, in that they will not be able to be displayed.
Okay, thank you. And then my final question is about the awareness of public spaces legislation. So you're taking the powers to restrict people's ability to smoke and vape outside in places that you've chosen reasonably sensibly, but you could extend those. If you do extend them, how will you ensure that people know about them so that they're not inadvertently criminalised because they just didn't know that you have... The Secretary of State has can in the morning wake up and decide that he or she, depending on what it is at the time, wants to change this public spaces legislation, that they can very easily do so. How will we make sure people know that it's been done?
Well, we can't easily do so. The powers in the bill mean that we have a statutory duty to consult. As we've already heard, Wales already covers the areas that we wish to consult in respect of England. Scotland, Northern Ireland and Wales will have their own consultations, but as far as England is concerned, the government has been very clear that should this bill pass, we will consult on implementing smoke-free outdoors around children's playgrounds, around schools and outside hospitals. I think given the media interest and speculation that there was over the summer as to outdoor areas that the government might extend the outdoor restrictions to, including hospitality, I don't think it would be the possibility of any government to just wake up one day and decide we're going to extend these measures to X, Y and Z and nobody notice. I think it would be on the front cover of every newspaper. It would be all over X and Facebook and Blue Sky and other social media. People would be very aware of a government's intentions to extend outdoor smoking, and we would be under a statutory duty to consult and to pursue secondary legislation, which of course is ultimately subject to a vote of the House.
The Welsh government are apparently struggling with compliance in hospital areas. What have you learnt from your Welsh counterparts on how you can ensure that it's better enforced and better complied with in England?
So I think that's a really important question, and it's why at every opportunity today I've been asking those with an interest in public health in Wales what lessons we can learn. Look, we want to get this right, and the reality is that as well as the package of enforcement that we will be bringing forwards, as well as the registration, the licensing scheme, the fixed penalty notices, we have to to approach this with a degree of proportionality, and particularly to ensure that there is as good a compliance with the regulations as possible. Look, most people are law-abiding citizens, and what we saw from the smoking ban indoors that was introduced in 2006-07 was that most people complied from day one. And, you know, I really expect that in respect of children's playgrounds, schools and outside hospitals, most people will comply, and I would hope that the enforcement agencies use a degree of discretion and proportionality in the outset to ensure that those that aren't complying understand that they are potentially breaking the law and should stop doing what they're doing.
Okay, thank you, Jeff.
Okay, with about 15 minutes left and with 5 members who wish to ask questions, so if we could do it briefly and obviously briefer answers as well. Liz Jarvis.
Thank you, Chair. Thank you, Minister. Lord Bishard mentioned the issue of border force, and I wondered if that is going to be a consideration in ensuring that border force has got enough resources to make sure this bill is implemented successfully. And also, Matthew Shanks mentioned in response to my question about a public health campaign, are there any plans to have a public health campaign to back the bill?
The short answer to both of those is yes. Look, we have committed to an investment across HMRC, trading standards and border force of £100 billion over the course of the next 5 years to enforce these measures. We are very keen that as far as public health campaigns are concerned, and it's £100 million, sorry, the Treasurer will be having a fit with me, getting my billions and millions wrong. I wish it was £100 million. And in the case of the public health campaigns, look, we have committed already just this week to the £70 million for smoking cessation. I have signed off for this new year a very concerted public health campaign on social media and broadcast media for smoking cessation. And as this bill progresses and becomes law, there will be a huge public health publicity campaign so that everybody is aware of our smoke-free 2030 target ambitions.
Fantastic, thank you.
Minister, just a couple of points, if I may. First is to do with poverty and how this bill affects those that are disproportionately impacted by not only smoking but by second-hand smoke. We heard from our CMOs and from Professor Bald the impact that smoking-related diseases has, particularly in those populations. It's not often in our lives that we get an opportunity to use an instrument that has the potential to change the trajectory of the lives of people who are at the lower end of the economic spectrum in society. What do you think will be the impact of this bill upon them? And secondly, if I could ask you to make a more wider comment on the historical context of this bill. In 2006, it was a Scottish Labour government in the Scottish Parliament that set in train perhaps some of the processes that we're trying to finish the job on here today. And over those 14 to 15 years, we've seen many positive short-term and long-term public health outcomes. What do you think will be history's judgment upon this proportion of that journey?
Two very good questions.
Shorter than the question.
Yeah. I mean, in terms of this bill, it is a landmark piece of legislation, and I think it will be the biggest advance in public health for a generation. It will be a truly historic thing. I mean, what a wonderful thing to say that in the near future, no child born after the 1st of January 2009 will ever legally be able to be sold tobacco. And that leads me on to your first point. Tobacco is a killer. It kills around 80,000 people in this country a year. It is responsible for a quarter of all cancers. It puts enormous pressure on our NHS and on our economy. And the death rate of somebody in a more deprived part of our country is over 2 times higher as a consequence of smoking. Look, there's no reason beyond smoking as to why the life chances of somebody living and growing up in Richmond is so better than somebody growing up and living in Blackpool. And that's because the smoking prevalence of somebody in Richmond is around 4.6%. And the smoking prevalence of somebody living in Blackpool is still over 20%. This will save lives. This will narrow health inequalities. And that's what all of us, irrespective of our parties, all of us was brought here to do.
Dr. Becky Cooper.
Thank you, Chair. Thank you, Minister, for that rousing speech. I'll keep it brief. I just wanted to bring you back to smoke-free spaces. As you say, the bill is going to lead to smoke-free spaces outside schools, children's playgrounds and hospitals, all very laudable and very evidence-based. I think it is important, if you can, that you actually address the issue around hospitality settings. Could you please state to the committee why that is not currently in the bill as it stands?
So we wanted to have a proportionate approach. We recognise the difficulty that the hospitality sector has gone through and is in. We listened to the voices of concern. And look, we decided that as far as England is concerned, and I can't speak for ministerial colleagues in Scotland, Wales and Northern Ireland, but as far as England is concerned, we wanted to target outdoor smoke-free places to areas where children and where the most vulnerable are likely to be. And that leads to the logical conclusion of outside hospitals, where there's a lot of vulnerable people going through the doors of hospitals, outside schools and outside children's playgrounds.
Okay, thanks. Alex Barros-Curtis.
I wonder, Minister, if you could just say a little bit more about why the four-nation approach. Obviously, I say that as a Welsh MP myself, and we've talked about some of the really positive and progressive examples that have been illustrated in Wales and which we can learn from. But is that four-nation approach one of the real strengths of this bill in order to ensure that you get that that world you've talked about, which I think we all agree on this, well, not to speak for everyone, but I suspect we all support. So just wonder if you could say a little bit more about that four-nation approach, and if that is one of the key strengths underpinning this bill.
It is, and look, the four nations that make up our United Kingdom have gone at different speeds and at different depths in terms of tobacco control over recent years. And Zabir was absolutely right to point out it was the Scottish Labour government that first introduced the indoor smoking ban, and we followed suit soon after. But I think that it's really important that the four nations stand together on this, not least because some of this does require a four-nation approach in legislative terms, but also it means that we can meet this ambition together, that we're all in this together, because for me, a health inequality in parts of Greater Manchester is just as important as a health inequality in Glasgow or in Cardiff or in Belfast. We need to tackle these inequalities because it is a scourge on our society, and that's why having a four-nation approach and having the permissive nature of this bill, so that the four nations can go forward together, but can also diverge on the basis of extending consultations and so on. And I think that's why we do have the support of the devolved nations and the ministers who come from different political persuasions across Northern Ireland, Wales and Scotland. We're all in one as far as this bill is concerned, and we've shaped it together.
Thank you.
Okay, Mary Kelly-Foy.
Thank you, Chair. We've heard from all the witnesses today overwhelmingly how important this bill will be in terms of tackling inequalities and bringing about a smoke-free future. And I'm very confident that this will pass. In terms of supporting the 6 million current smokers that we have in the UK, do the government still have plans to make good on their pledge to produce a roadmap and a strategy as to how targets can be reached, especially in places like the northeast or in those other deprived areas, so that we can keep an eye on those smokers who do want to quit and what the smoking prevalence ranges are in those areas. Because I think there is a few of the witnesses and some of the submissions have called for that. That would really help them.
Look, this is really important, and I want all members to understand that a key aspect of reaching our smoke-free ambition is to drive down the prevalence of current smokers. And that means a real investment in smoking cessation. It means a close eye on what's happening on the ground. And it means using the flexibilities in this bill, should they be needed, to ensure that we reach that smoke-free ambition. We've announced the £70 million of Stop Smoking funding just this week. That has been weighted towards the areas with highest deprivation and highest smoking prevalence, so that we can really try and drive down those inequalities. Obviously, future years' funding is subject to the usual processes of the spending review, but let me make it very clear. It is a priority of this government to invest in stop smoking services, and we will ensure that local authorities and the public health functions of this country have the resources we need to reach smoke-free.
Okay, last but certainly not least, Taiwo Owatimi.
Thank you, Chair, and thank you, Minister. Just following up on Alex's question, what engagement has been made with the Irish government with regards to the differences between what's happening in Ireland and Northern Ireland? And do you think this will lead to changes also in Ireland in terms of moving things to a positive direction?
That's a really interesting question. Firstly, there has been really close engagement between the UK government here and the devolved nations, and certainly we have the full support of Mike Nesbitt, the Northern Ireland Health Minister, who has helped shape this bill, and his officials have helped shape this bill. The UK government and indeed the Northern Ireland Executive are in close dialogue with colleagues in the Republic of Ireland to make sure that we discuss at length and in detail the cross-border issues, and we will continue to engage with the Republic of Ireland to make sure this works. Now, whether the Republic of Ireland decide to follow suit, only time will tell, but I think this bill will be a real game changer, and other countries will want to follow the United Kingdom's lead.
Okay, well, very short time now. I can't really take any more questions, unless you want me to guillotine the debate. The question is that further consideration of the bill be now adjourned. As many as are of that opinion say aye. Aye. To the contrary, no. The ayes have it, the ayes have it. Order, order.